motion to approve the minutes of 10/19. So moved. Been moved by Representative Ulrich, seconded by Ryan Hale. Open for any amendments or changes?
Mr. Chair, I will abstain. We weren't given an opportunity to review the minutes. Thank you.
The committee of one thing, and that is the charge of this committee. And so the charge of this committee as outlined in 176-16-B, Roman numeral 1, is pretty clear. It is hereby establish a commission to study with the purpose of proposing legislation of state-controlled cannabis and cannabis products, right? So understand, we're not here to discuss legalization. We're discussing how to put a bill forward that would do legalization, but do it in a manner that is most protective of our citizens and regulatory and our regulations. So I want to be clear that while I know we've had a lot of discussion about legalization, that really isn't the charge of the commission. The charge of the commission is to put the best bill forward possible if legalization were to happen in a state-controlled model. And so when we're talking to the various speakers or ourselves, again, what do we need to add to a bill to take care of any concerns you may have about about legalization for our citizens?
Yes, thank you, Mr. Chair. I just want to put forth a reminder that at our first meeting, we agreed that we would be hearing from experts from legalized states with the impact, to investigate issues on the impact of those states, also hear about the impact on the health and safety of youth and young adults, and the impact on mental health.
Right. And again, I think, but again, to the charge of the committee, which is to put a bill forward, the
Yes.
goal is to take that information and to make ours better than Colorado. To make
Exactly.
our bill and our legalization better than Colorado that might have had an issue. And so it's what do we need to put into the bill to make the
right.
bill better, so that we don't have the issues that were done in other states.
Right. Study commission.
And with that, I'll call up our first speaker, Dr. Omar Shah. If you please come up and turn the microphone on, introduce yourself, that'd be great.
Hi, thank you so much for having me here, Chair and members of the committee. My name is Omar Shah. I'm an adult, child and adolescent psychiatrist and addiction medicine specialist. I'm currently full-time faculty at Boston Children's Hospital and clinical instructor of psychiatry at Harvard Medical School. I work in the adolescent substance use and addiction program in the Division of Addiction Medicine at Boston Children's Hospital, which provided more than 8,000 visits to the young people and young adults with substance use disorders last year. I personally have treated around 150 patients myself. I'm familiar with the New Hampshire legislature as I served as a New Hampshire legislative liaison for the New Hampshire Psychiatric Society during my child psych training at Dartmouth, which ended in July 2022. I currently serve on the Massachusetts Medical Society's Mental Health and Addiction Committee. I was asked by Katie to come here to inform deliberations. Rates of marijuana or cannabis use among teens is at its highest in 3 decades. THC, which is a psychoactive chemical made by cannabis plants, is an addictive substance that is particularly harmful to brain development during the teen years. While many states have legalized cannabis products that contain THC remain illegal by federal law. Therefore, the federal government does not provide support with regulation or oversight of THC based products as it does for alcohol and nicotine. Regulation of addictive products is complex, and states, including New Hampshire, lack the infrastructure for doing so appropriately at this time. As a result, state-based legalization of cannabis products exposes the population of the state to public health harms. THC impacts many areas of the brain, which are important for almost everything: decision-making, impulse control, emotional regulation, pleasure, perception of time, cognition, and even physical coordination. There is a strong association between use of cannabis products that contain THC and psychiatric disorders, most notably psychotic disorders. Use of cannabis products, particularly during youth, is associated with poor functional outcomes even in adulthood. Most notably, it lowers educational and vocational achievement and higher rates of mental health disorders such as anxiety, depression, and psychosis. Cannabis use can also affect multiple organs in our bodies, like the lungs, cardiovascular system, through the vaping and smoking process. Also, at Boston Children's Hospital, we have the vaping clinic where we're seeing young adults and teenagers for the first time having issues with breathing, shortness of breath, decreased exercise tolerance. When you look at their lungs, to the help of chest X-rays or CT scans, you see hyperinflated lungs and consolidations, which we normally see in people with COPD and elderly who've been smoking for decades. In Massachusetts, where I practice, psychotic symptoms, cannabis hyperemesis syndrome, and lung injury from vaping have become increasingly common. In fact, these conditions were almost unheard of a decade ago. I personally have dealt with several patients who have experienced these conditions due to cannabis use. In the past decade, many states legalized the recreational use of cannabis for adults 21 and older. While a young person's use of cannabis remains illegal in all states, the new laws increase the availability overall, making the drugs much more likely to land in the hands of teens. Furthermore, legalization makes it confusing for teenagers when assessing the safety of using cannabis. One of the most common questions, for example, I get asked by my patients is, if marijuana is so bad for you, then why is it becoming legal to use for everyone everywhere? According to a study published just this Thursday in the Journal of Addiction, people who live in the U.S. states that legalized recreational cannabis use, they use cannabis up to 24% more frequently than those in states where it remains illegal. The study also included 111 pairs of twins, and they compared the twins who live in legalized states versus the ones who did not live in states where it's legal, and there was up to 20% of the twins living in the states where it was legalized were using cannabis. This leads to well-documented, evidence-based risk factors concerning substance use in teenagers. This includes parental substance use and unfavorable or permissive parental attitudes towards cannabis. And on the flip side, protective factors for the youth include parental disapproval and school connectedness. And I mentioned school connectedness because we see this all the time at the Children's Hospital. Cannabis use is associated with poor school performance, skipping classes, truancy, and low grades. So we're oftentimes working with schools to address those issues. A study published just last week in the Journal of JAMA Network Open documented that some people with pain, anxiety, or depression who obtain medical marijuana cards overuse cannabis and develop cannabis use disorder, failing to improve their symptoms. In fact, indeed, 10% of them had developed a disorder in just 12 weeks of getting or obtaining the card. And those figures rose to 20% if they were using it for things like depression or anxiety. And lastly, even CBD, I've talked a lot about THC, but CBD also, or cannabidiol, is another chemical made by the cannabis plant, which we feel like is, the good part of cannabis is how we put it, right? But the thing is, there's little regulation of CBD products, and studies have found that many products are mislabeled, often containing less CBD than they label themselves. A recent study of 84 CBD products purchased online found that more than a quarter of the products contain less CBD than labeled, and THC was found in 18 of them. In high doses, even CBD can cause side effects such as dry mouth, diarrhea, reduced appetite, drowsiness, and fatigue, and it can interact with many medications, including blood thinners. Perhaps most concerningly, the impact of CBD on the developing brain has not been studied, and we simply don't know the exposure that it has and the impact it has on children. There's a major concern because we know that the cannabinoid system, which is sort of like the natural marijuana in our brain, is very active in guiding brain growth and development throughout childhood, adolescence, and even in young adulthood. while the risk of this exposure may outweigh the benefits for children with severe seizure disorders, we prescribe them Epidiolex, which is FDA approved, but the risk benefit ratio may well be quite different for children who don't have these problems. For these reasons, I recommend New Hampshire be cognizant of all these different impacts and facts concerning cannabis while making their decision on future um, legislature concerning cannabis products. Thank you so much.
Thank you, Mr. Chairman. First of all, Doctor, thank you very much for coming. Um, Doctor, we've heard, when we legalize medical marijuana, and we say that it could do something for an individual that other medications can't do. Kind of fill me in on why you think why that's the right way or the wrong way to do it, and why does it affect a person where other medications can't?
Well, thank you so much for that question. So, medical marijuana is only so far approved for two conditions. One is severe intractable seizures, where no other medication works, and we're just trying to get these people just stabilized. So it's sort of, I can say, emergency situations. And then the other situation where cannabis is legalized is for people who are pretty much have a condition where they are dying and they have pain, and this is something which could help them for their pain while they're not doing that well. So these are the only two conditions where marijuana is medically okay to approved, and these are FDA approved. These medications, such as Epidiolex, right? The thing is, once you get away from these two conditions, it's very hard to see the benefits of marijuana overall compared to the potential side effects that it has, and that's why the medical community so far overall, large part, has been very cautious when prescribing medications. And when you prescribe medications for recreational use, whether it be at alcohol stores or any other stores, it gives people the wrong impression, and we're seeing the impact of that on the youth in Massachusetts, where I work right now.
Further question? Yeah, thank you. So if all of this is present, and if we have scientific, evidence that says the negative effects appear, what is the mitigating factor that is pushing the other way? What is the driving force?
Driving force for legalizing
Yes.
kind of, I mean, this could be a matter of opinion, but I personally feel there's a lot of financial gains from this, which is what I see, and of course, on the symptom side of this, a lot of patients do feel relief when they use marijuana for anxiety and depression. However, those, it's sort of like a band-aid. It doesn't fix or cure the problem. You're intoxicated for a little while, you feel good for that particular period of time, and then it's over. But the underlying reasons you were using in the first place, like anxiety, depression, they don't get better. So that's why we use other medications which are FDA approved for such conditions, and also use therapy. And there's various types of therapy we use which have been shown to benefit people with underlying conditions such as anxiety and depression. And also, unfortunately, cannabis is very highly associated with psychotic disorders. So I'm seeing a lot of kids, teenagers, like 19, 20-year-olds, who have first break episodes of psychosis, and a lot of them have been using high doses of cannabis.
What further questions, please?
Follow up again?
So, now, in your role as a practicing physician, how many kids do you see that have been involved with marijuana or using marijuana quite heavily? And you're seeing some of the effects of this
Yeah.
on the kids.
Yeah, so in fact, most of the kids I treat pretty much use cannabis. Nicotine and cannabis, and even alcohol, but especially nicotine and cannabis are the most common substances that kids are using, actually. Yep, for sure. More than 90%, I would say.
It just, let me end with this.
Yep.
We were given a con job about cigarettes. And for years, you know, it was, makes you feel good,
Uh-huh.
take away your anxiety and so forth and so on. And what did we get out of that? Cancer,
Hmm.
lung cancer, pervasive, a number of other situations. The body parts fell apart. We have a settlement now with the tobacco industry.
Yep.
And yet we're still smoking. Problematic. So
I'm glad you brought that up, actually, Senator. The thing is that, just like you said, so for decades, there's a lot of financial gains, and cigarette companies, and we're making a lot of money, and unfortunately, it impacted society in a negative way for the most part. And the thing is that now those same companies have, I won't take any names, but the same companies are now targeting the youth because it's almost like the adults are wisened up. So now they're targeting the youth, saying that things like marketing vape pens as benign and not really containing nicotine and not very dangerous for you. It's kind of cool thing to do. It's just water vapes, which is actually not the case at all, because now it's so widespread. It's an epidemic. Actually, we're seeing kids, as I mentioned earlier, with lung issues, which we never saw before. There's this thing called EVALI, or e-cigarette and vaping associated lung injury. It's a new thing. I believe it was coined back in 2019, not too far back. And that's where we see kids with shortness of breath, decreased exercise tolerance, coughing, and the thing is that I have a feeling that once society wakes up, maybe another 10 years, vaping might be banned. That's just my opinion, but who knows? But that's where we are right now.
thank you, Mr.
Thank you,
Chairman.
Senator. So I have a couple of questions real quick. So obviously, the bill doesn't allow for underage consumption, right? So 21, under 21 is illegal in the state, and would be illegal on the proposed bill. So my question comes: is that early enough? And if not, what's the science behind not doing it later than 21 if we were to pick a different age? And so I'll start with that. I have a follow-up question to that as well.
Okay. No, thank you so much for that. So the thing is, what is, 21 or even 24? The thing is, once you legalize, substances, like for example, alcohol has been legalized, right? And nicotine, right? In the past. So if you legalize cannabis, you'll see the same impact that the other substances have had on society. And the thing is that, so most of the kids that treat, it's not like they're getting marijuana through their doctors or any such means. They're getting it off the streets. And their main logic is that, hey, listen, it's legalized in most states. It's not a big deal. It's not like I'm doing cocaine or heroin. And so that's the way they justify it. And it just makes it harder and more difficult for providers such as myself and many other providers to provide treatment. And we have to sort of, educate them on the brain. And we call it like the neurobiology sessions at Children's Hospital, where we educate them on the brains and how substances affect them. And it takes time. And a lot of these kids do get better when they realize what's going on. But I feel like legalization or even having it in the market, just, for example, like I walked down in Massachusetts. I walked down some very nice towns, and there are these nice stores. Like, they look very nice, and they have these vape pens in there, and cannabis and CBD and certain products which will help relax you. In fact, I feel like going and getting one myself. It's just so nicely marketed. So imagine kids, right? So these are just the concerns I have, and how do we address this? Maybe like if we can have tests and done on these products, FDA takes a look at it, regulates them, then maybe they can be prescribed for certain conditions and not just openly available in the market.
Thank you. Let me just have one more follow-up question. So I'm assuming you would support, if a legalization model is to go forward, given the conditions you've just outlined, you would support enhanced penalties for the sale of marijuana to any kind of juvenile, any kind of minor. You would support enhanced penalties against the retailer or whoever's providing it.
Yeah, I mean, the reason I don't want to, that could be the case, but I also am a little cautious about the penalty part, because the thing is, I've also seen the flip side where minorities and underprivileged populations are using marijuana and then they're going to jail for it and their lives are destroyed. So there could be a better way. For example, Brown University, I know they have a prison system where they're treating people instead of penalizing them. So there could be many other alternatives to that, but but definitely we need more guidance in this situation for sure.
So to be clear, I'm not talking about possession, enhanced penalties for possession for minors. I'm talking about enhanced penalties for someone who provides
Provides,
marijuana
okay.
to a minor.
Sure. I mean, yeah, sure. That could, maybe that could work.
Great. Thank you. Question, doctor?
Um, Thanks. So my question is we're talking about age, and we know that children exposed to marijuana, sort of the earlier, those that are predisposed to things like schizophrenia are, that increases the likelihood that they will develop that mental illness. Do you have any sort of age parameters, sort of capitalizing on what he was just saying in terms of like exposure starting at what age it increases that risk, and by sort of what fold?
Sure. So the thing is, brain development actually technically, theoretically ends at age 25. So there's a beautiful factoid out there. If you don't use substances till the age of 25 or 26, it's very rare for you to have any substance use disorder afterwards. So if a person starts using substances at age 30, I'm not saying, I'm not encouraging that, but if they do, it's very rare for them to actually have a use disorder. And there are many factors which go into this. So when you're younger and you use substances, right? The thing is, a lot of these, so it's easy when you're stressed out and you're 19 or 20, you're stressed out, you grab a joint and you smoke it or vape it, right? The thing is that you feel good, you feel relaxed, but the underlying causes problems are still there, right? So the other caveat is that you don't develop coping skills. So when you stress out, instead of dealing with it and maybe using strategies such as working out or talking to your family or communicating or whatnot, these kids are just picking up drugs and using them for coping skills, and then they don't learn coping skills. So it just becomes easier for them to just have this as a crutch and just keep using this in the future. So age 25 is when neurodevelopment is pretty much complete in most people.
Follow up?
Well, yeah. So I just want to clarify. It sounds like you don't think that raising the age to something like 25, which, in theory, if people were using after that point, would put them at a lot lower risk of a cannabis use disorder, would really change that just based on the sort of permissive attitude shift or sort of cultural change. Is that?
Yeah. So no, that's a wonderful point you brought up. So the thing is that I think raising the age, yeah, of course, that's not the as you said, that's not the solution, but it may help in a sense that at least people, it's different from 21, right? So then people might be thinking, why is it 25? And it would just make them think a little bit more, maybe. Like it would maybe make them a little more cautious. So maybe that could be one good thing coming out of it.
Thank you. Anything else, doctor? Question?
Thank you, Mr. Chair, and thank you for taking my question and for your testimony. Very comprehensive. I appreciate that. You mentioned a JAMA medical study where the participants developed CUD, cannabis use disorder, in 12 weeks. Can you tell me the age range? Were those adolescents or adults or a combination?
Yeah. So it was I think the age range was young adults, but there were, it was mostly young adults, if I'm not mistaken. Yeah.
And that would be prior to the age of 25?
Yes. So we consider young adults till age between 22, 24. I would consider young adults. Yep.
Okay, that's great. While the brain is still undergoing
Yeah,
development. Okay, so that makes them, when the brain is undergoing rapid development,
Uh-huh.
It's more vulnerable to addiction, correct?
Yep.
Okay, and
Follow-up question?
okay, follow up. At the outset, you mentioned that you treated 100. You are treating or have been treating?
I have been
150
treating.
patients?
Like at this, yeah, they're on my panel. Yep.
And you said 90% of those are using cannabis.
Like the 90% is just my own estimate, but most of them are using more often than not. Yep.
Okay, and so would the majority of those be under the age of 25 as well?
Yes.
Okay,
Thank you.
thank you.
Any other questions for the doctor? Yes. Representative Ulrey.
Yeah, thank you for your testimony today, Doc. Appreciate it. You're talking about addictive behavioral disorders in general. And age 25 seems to be a commonly heard number. I know we've heard it at county when we've been talking about setting up treatment centers for various things. And when we were discussing the sexual orientation, there's something about your brain that kind of gets set at age 65 for pedophilia, if you will. The question is, addictive disorders are present, and yet we allow children to smoke cigarettes. We allow children to, well, young adults to buy alcohol at 21. So why don't we just raise everything to 25?
I agree. In fact, if it was up to me, I'd ban alcohol and nicotine.
Any other questions for the doctor? So doctor, I'm going to just ask one more question. Again, it's about what would be in the bill proposed. What would you add to a bill, assuming again legalization was going to happen? What would you add to the bill to help with the issue of substance disorder, substance use disorder, or cannabis use disorder? What would you add to the bill?
I guess when they're marketing it or selling it, at least provide this information somehow, on the box, maybe that, brain is developed until the age of 25. And of course, make sure the kids don't get it. And then if we can have something in there where if adults are using, they should make sure the kids, it doesn't fall into kids' hands. And if it does, there should be some sort of consequence for that. I'm not sure what that is, but something, some responsibility.
Thank you. We're all set. Thank you, doctor, very much.
so much.
And I'm going to turn the gavel over to Senator
Thank you so much.
We're on Amy. She's next.
Next, we're to talk to Amy Turncliffe. Do have a copy of written testimony, so you don't have to recite it. And then just to clarify, the order of the commission is to put together.
I went over that already.
We'll just do it on the phone. Just the order of the commission is to put together a recreational policy, and any suggestions you have for that, assuming that one would become law. What I'm, you don't have to read off the paper. We're not asking if someone supports recreational cannabis or not, but any advice on perhaps put.
Okay, thank you. I'll let you know who I am, and then I would like to actually drill down a little bit in the mental health harms. And I know that Dr. Shaw touched on a little bit the mental health harms, but that is my area of expertise. And I think it's really important that you fully understand the cannabis-induced psychosis, conversion to psychotic disorder, and how devastating that is for families. And I think this is clearly outlined in the prescribing insert of FDA-approved THC-based medications, but doesn't get nearly enough attention. So if you're considering legalization, you're considering cannabis policy, I think what states have failed to do is go back and look at that prescribing information and really look at what does that say. All of the risks are clearly outlined, and the amounts of THC that are in the legal markets is astronomical. And what people are allowed to possess and purchase are completely out of line with what is in, outlined for risks in the prescribing information. So thank you for allowing me to speak today. My name is Amy Turncliffe. I have a PhD in neurobiology from the University of North Carolina at Chapel Hill, and did my postdoctoral training at Harvard Medical School. My area of expertise is mental health and substance use disorders, with a focus on cannabis use and cannabis policy and the impact on adolescent and young adult behavioral health. And I've testified over the past 8 years in Massachusetts, and I cannot tell you how frustrated I and my colleague clinicians and scientists are, and which is why we did put out a statement of concern in 2019. Because we really feel like a public health framework for legalization has not happened. It has not happened in Massachusetts. It has not happened in any legal state. And then I think it's important to say that my motivation for being here is not strictly professional, it's personal. I am a fourth generation property holder in New Hampshire. My kids are the fifth generation to enjoy summers on beautiful Millen Pond in Washington, and my family absolutely loves the White Mountains. We also own a home in Waterville Valley. As I said, I would like to, I would reiterate what Dr. Shaw said about the brain isn't fully developed until the age of 25 or 30. And there's a whole host of negative consequences that result from adolescent and young adult cannabis use. With that being said, the literature shows that, from the very beginning showed that adults do and can experience cannabis-induced psychosis. And about 35, I think the literature has shown, and I think it's in I will say it in my testimony, about 35 to 50% of people who use will experience. And so to your point, which is that while the adolescents are, if they experience cannabis-induced psychosis and they don't stop using and they continue to experience psychosis symptoms, their brain is still developing, they have a lot of neuroplasticity going on, they're probably more likely to convert to a psychotic disorder. Literature shows about 50% of those who experience cannabis-induced psychosis go on to convert to a psychotic disorder if they don't stop using. It's probably less likely that adults will transition to a psychotic disorder that isn't then reversed when they stop using. But a lot of people don't know that psychosis symptoms is a consequence of cannabis use, or I should say THC. When I say cannabis, really it's THC, and that would include like Delta 8. I know parents whose kids have been put into cannabis-induced psychosis from using some of the derivatives, including Delta 8 THC, as opposed to Delta 9. So
Just one question. Is there any recommendation or opinion you would have on what a warning label would say on a recreational product?
yeah, so in Massachusetts, I was a lead author on some bills that we had filed on our behalf to do just that. So to warn about cannabis-induced psychosis and suicidal thoughts and behaviors and anxiety, paranoia, hallucinations, delusions, that go along with psychosis. In addition to cannabinoid hyperemesis syndrome, which is not my area of expertise. However, because cannabis policy is an area of expertise for me, I am in several groups for where patients and families are discussing cannabinoid hyperemesis syndrome. And I don't think, again, that most people realize how devastating and life-threatening CHS is. It is extremely expensive, with dozens and dozens of visits to the ED and unnecessary surgeries and things like that. So I could say a lot about what a warning label should include, but
My concern is if the warning label's too long.
yes.
I'm not sure everyone's gonna read it.
Yeah.
So you want it to be, obviously you listed a number of concerns.
Mhm.
I feel like if we listed all those concerns on a warning label, I'm not saying it's not
Yep.
worthy of being on there, but for
Yeah.
the average consumer,
So
I want to try
Yep.
to keep it.
let me tell you that in California, because I work closely with folks in California who are also trying to put more public health focused policy in place, they have proposed a required, something that would be like a prescribing insert, but not just for medical products, a required insert that goes with products that clearly outlines the risks and where individuals can find help or what they should do if they experience those symptoms.
So like a larger warning label inside the,
I mean,
bag of-
would be like an insert.
but what about just the label of the package, which is, not very large? Maybe
Yeah.
the at most, it's half the size of my name tag.
I think you're getting to the point, which are, there are a lot of warnings. There are a lot of risks that people don't know about. So other ways to address that are public awareness campaigns, which I don't particularly find all that effective because it's just hard to get the message out. But because there are so many risks there, you could do something like tobacco, where there's a rotating warning and they have to change the warning every so often, so that all of the warnings are seen by consumers over a certain period of time. So, it's not so cluttered, but it's a real problem. I mean, it is.
But I'm asking you with your expertise, what would you prioritize
Oh.
on a warning label
Yeah.
that's less than 50 words or less than 25?
So I think you have to prioritize that if you're pregnant or, going to become pregnant, so pregnant women should not be using cannabis products, even though, we know from the literature that dispensary workers tend to recommend them to pregnant women. I would absolutely prioritize cannabis-induced psychosis symptoms, mental health symptoms, anxiety, paranoia, etc.
If you could perhaps maybe not at this moment, but maybe email the
Oh, yeah.
commission a suggested warning label, that would be appreciated. That can fit on the package of a product.
It's going to be very challenging, like I said.
You're up for it though.
So as I mentioned, I would like to just dial down into the cannabis-induced psychosis for a second. And it is well accepted that THC can induce acute psychotic symptoms. That literature comes from the clinical trials that supported FDA approval of THC-based medications. And those were with adults. So the association meets Bradford Hill criteria for causation, which means that it's not just those who were predisposed to develop a psychotic disorder that necessarily will develop the psychotic disorder from cannabis-induced psychosis. Centuries of good quality data, much from the last decade, show that THC can induce acute episodes of psychosis in a dose-dependent manner, and that the conversion rate from cannabis-induced psychosis to schizophrenia or bipolar disorder is higher than for any other drug-induced psychosis at nearly 50%. In human laboratory studies concerning healthy adults being administered THC, it has been approximated that 35 to 50% of those who will experience psychosis symptoms go on to develop cannabis psychotic disorder.
And I understand, and I'm not advocating that cannabis is healthy in any capacity. It's not the role of the commission. The commission our role is to put together a recommendation on a recreational policy, on a state control model, which.
I understand what you're saying about that.
So I guess we've heard testimony. I understand that there's potential harmful side effects of a lot of things. I guess, how would you recommend we incorporate the facts in your testimony and what you're saying, even with your written testimony, into a recreational policy that would mitigate those negative impacts?
I'm going to be completely honest with you. I don't think you can mitigate them. I think you need to prepare for how you're going to, and my last bit of testimony is about who's going to be held accountable for the increase in psychotic disorder. We have decades of experience, and we talked a little bit, I heard about tobacco industry. So the tobacco industry ultimately was held accountable for, through settlements and et cetera. And the outcome of that was a lot of change in tobacco policy as a consequence of those lawsuits. Those of us who are public health advocates do believe that there will be a reckoning down the road. And you heard Dr. Shaw say, maybe a decade or more from now, all of this is going to come tumbling out, because there are a lot of parents whose families are really irreversibly harmed by psychotic disorder. So you can put out public awareness campaigns. I mean, we can list off, and I did bring a copy of the statement of concern, and you may have seen it already. And there's a public health framework that has been put forward for legalizing cannabis. And I would recommend, if you want to attempt to mitigate all of the harms that will come with legalizing, commercializing, I would strongly recommend that you utilize a public health framework. But I don't want to mislead you and tell you that I think that is going to mitigate the harms. I don't. Do I think you might reduce them slightly? Maybe. And we have reduced tobacco use over time, but there's a kind of a curve that happens with that, right? You see this huge amounts of harm with thousands and thousands of people dying, hundreds of thousands of people dying as a result. The thing with cannabis is you don't see that stark death, right? It's not lung cancer per se, or that we've seen so far. Mental illness is it creeps in, right? And it's hard to quantify. The United States doesn't do a great job of quantifying mental illness, and researchers are starting to do that. But I don't want, like I said, I don't want to mislead you and tell you that by using a public health framework, which, like I said, I think you should use, that it's going to be a magic bullet, because I'm certain it won't be. And for a lot of the reasons that Dr. Shaw said, which is a lot of what happens is around perception, social norms, and kind of youth will gain access. You can put the age at 25, you could put the age at 30. Young people are going to gain access. And in Massachusetts, surveys have been done, and particularly in Western Mass, where a lot of our dispensaries are concentrated. And they're showing that the majority of young people are saying they're getting their cannabis products, and they are using more product than they had been before legalization. They're getting the majority of their product from legal dispensaries. And that's not to say they're walking into businesses and purchasing, because they're not. They're getting legal product through diverted sources. So what we might call like the gray market. So, if you ask kids where are they getting their marijuana, they'll mostly say from friends or at a party. So it's social sources of access. But now they're accessing legal product through social sources, through an older sibling, through parents. They're paying like alcohol, they're paying someone to go get it for them. So you can work really hard, and I'm not saying you shouldn't work really hard to reduce youth use, but you're going to see an increase in youth use for all of the reasons that Dr. Shaw said.
Would you believe that in 2 years of a medical marijuana dispensary opening in our region, we saw a 88% surge in youth use? And
I would believe that.
would you also believe that 4 toddlers were admitted to our emergency room in THC-induced comas from edibles? The director of poison control says sooner or later, we're going to see some deaths.
Yeah. So there was I just coordinated a group of clinicians and researchers in Massachusetts to meet with our joint committee, our legislative joint committee on cannabis policy in Massachusetts, just last week, actually. And what the clinicians say is they would like to see medical marijuana go by the wayside, because it sends a message to young people that it's safe and healthy. And so they believe, and for the reasons that Dr. Shaw said, there are FDA approved THC-based medications. Our medical marijuana program doesn't follow any of the guidelines that are put forth in prescribing inserts. It doesn't have any of the warnings. And if you look, as I mentioned, the maximum recommended daily dose is 28 milligrams. So you can barely find a product in Massachusetts that would deliver that daily dose. It's way beyond. And I provided a 1-page information sheet that kind of breaks down the math and lists the warnings that are on those FDA approved medications.
Mitigating as much as can be possible?
Yeah, very little, if any. So we don't have the same kinds of grant programs that I think California has a grant program where a certain percentage has to go back into prevention. In Massachusetts, we don't have that. And the money goes back into the program. So I know that Massachusetts has been, the Cannabis Control Commissioners have been tasked with putting out a public awareness campaign. I can tell you they did not consult anyone in the prevention or public health community on their campaign. When they rolled it out, it was, I'm going to be quite blunt, it was kind of the laughing stock of the prevention community, because it had a mom, and they put this on billboards. It had a mom and said cannabis is legal in Massachusetts. I mean, that was, kind of and then it had a website, go to this website. And it really was not based in prevention science. I would encourage you strongly, and I know you do have some prevention representation, I would encourage you strongly to utilize your prevention professionals who know what works in prevention. Those of us who do work in prevention find it extremely frustrating because we talk a lot about wanting to reduce addiction, but a lot of our policies contribute to addiction. So it's very frustrating, I tell you.
We are going to be putting out recommendations. What money coming into the state as a result of sales, how much, where that money's going to go in the state. You're talking about in the future about food that's coming. Do you think, what percentage would you recommend?
As much as you could possibly manage. Do I think it's going to be enough to offset the impact? Probably not. But I would again encourage, and that is one of the pieces of a public health framework for policy, is to prioritize prevention. But at the same time, we know that our best prevention strategies are what are called environmental strategies, and those really are our policies. And so when you take away our best, really one of your best prevention policies you have right now is that you don't have legalized recreational cannabis. When you take that away, you're going to take away one of your biggest protective factors.
And when you talk about the mental health issues that legalizing marijuana brings up, was Massachusetts prepared? Do they have enough counselors or treatment professionals to handle the surge?
They don't. No. And if you will allow, I would like to read this quote from, she runs a first episode psychosis program at Boston Medical Center. And she has provided testimony, and I would like to read what she had to say when she provided testimony to the Massachusetts legislature. She said, and again, she's a clinical psychologist at Boston Medical Center, Boston University, and Harvard Medical School. She said, I see many patients who have developed psychosis after using high potency THC products. The average age that my patients begin using THC is 15, and the average age that they develop psychosis is 21. Earlier age of first use, frequent use, and higher THC concentrations are all well-known risk factors for developing psychosis. While some of my patients are lucky in that they are able to stop using THC and eventually recover from their psychotic episode, most are not so lucky. For some, the psychosis does not go away even though they stop using marijuana, and that is the changes in brain function are irreversible. For others, they are addicted to THC and cannot abstain from using and thus cannot recover from their psychoses. Such histories are typical of a larger and larger proportion of our schizophrenia patients. A growing body of research demonstrates that these individuals are not necessarily people who would have developed schizophrenia without using marijuana. She goes on to say, I love my job, but I hope you never need to bring anyone in your family to my clinic because they have developed schizophrenia. So absolutely not. And I, in this meeting last week, she mentioned that she doesn't think people even know that this is a symptom. And so that psychosis is a symptom. So when they experience psychosis symptoms, they tend to use more because they think it helps their symptoms. But in reality, they're worsening.
I realize I'm just a stand-in this morning, but thank you, Doctor, for being here and offering your testimony. Do you see any kind of association between the mental health issues that you're talking about right now and mental health issues that seem to be plaguing our country in general?
So there hasn't been a great kind of study so far of the contribution substance use to the adolescent mental health issues. Certainly, mental health issues occur in adolescence for a variety of reasons, and substance use and cannabis use in particular isn't the only, cause. Though I will say, and I again put that in here, that there was a Wall Street Journal headline that was "Legal weed feeds the teen mental health crisis," and I will say that clinicians and scientists do believe that is true. And so I think, as I mentioned, we do believe that there is a worsening. And if you dial down and look at data, those that have mental health issues, they do use substances at higher rates. And it's hard to know, right? People will say, well, are they self-medicating? What's coming first? And the testimony I just read to you from this clinician, she said she has data to support the idea that in many cases, the cannabis use is coming first before the mental health issues, in particular, the first episode psychosis issues.
I don't think it's disputed that cannabis can be harmful to children, particularly. I guess any recommendation on what a state like New Hampshire should do when we're surrounded, now to say my district, District 22, I'm 4 towns, I'm surrounded by 5 dispensaries, and I'm fairly confident if Lawrence didn't have such a high crime rate, there would be a dispensary there. So I'm surrounded by these stores. So I feel like where I live, all these harmful effects that you're talking about, it's already there.
So
So I guess my question is, what's your recommendation to New Hampshire? Because we have the same, I'm sure some of the border communities along the Maine border can bring up the same issue, and I'm not sure about Vermont yet, but I feel like that's coming. So for us, we can do nothing
Yeah.
and keep it illegal. I get that. And we still have to deal with the cross-border issue. So any recommendation you have for the state on how to deal with that?
So I want to touch on one more piece of data that addresses what you just said, which is Western Massachusetts, as I mentioned, is kind of a hotspot for dispensaries. And so there are some communities that have no cap on dispensaries, and it's kind of, they call themselves kind of the Wild West of commercialization. And so they have kind of a county-based prevention system, and so they survey kids across an entire county. So they have many communities in their catchment, and they have found that those communities that have, and you just mentioned 5 dispensaries, that have dispensaries, and more dispensaries have more youth use and more use related harm. So again, I'm just going to say, you actually in your community, if you don't have dispensaries, that is a protective factor for the kids in your community.
Oh, let me rephrase this. There's 1 in Tingsboro, there's 1 in Dracut, and there's 3 in Haverhill.
Okay.
Okay, my community's Pelham, Salem, Axon, Plastow.
Mhm.
That just wraps around us like a glove. So I'm asking, what would you recommend to someone in that situation? Because as far as I'm concerned, there's one of them, if you go in the parking lot, you can see the Welcome to New Hampshire sign.
Yeah.
It's true, the one in Haverhill. So
Yeah.
what's your recommendation on an issue like that?
You know what I'm going to say, which is don't have any dispensaries in your own community. You might think that that's not, your kids in your community in New Hampshire are seeing what those dispensaries, they might be accessing product from those dispensaries, if that's what you think. I would say do some data collection if you are not sure what is the results of that. And yes, if they're seeing billboards in Massachusetts, we've got a terrible problem with billboards. The industry has been left to self-regulate, and so we have egregious billboards like Cannabis for Everyone, Life is Better with Cannabis. Absolutely no advertising to young people is a pillar of a public health framework. But I would still say that the majority of communities in Colorado opted out of recreational cannabis retail stores. So while there are, in Massachusetts, we have dozens and dozens and dozens of communities, including my own, that don't have retail stores. So what I would say is those communities, what the data has shown is the communities that don't have retail stores, That is a protective factor for their kids. You're sending a message to your young people. We don't think, we prioritize your health and safety. And so we're not going to have these stores in our community. And so the data has shown that that is a protective factor for our youth.
Thank you.
Thank you. The Surgeon General in 2019 stated that no amount of marijuana use during adolescence is known to be safe. Would that, something like that on a label, no amount of cannabis use is safe for adolescents? Be something that you would recommend?
Sure. But I'm going to say that young people are not typically using packaged product. They're using product that has maybe been sold and then is, purchased by an adult and then either repackaged or opened. And here's, you're going to pay me this amount of money for this. You're going to pay me this for this. So maybe that's helpful for parents so that they're not providing product in to their kids. But with that being said, Massachusetts does have labeling that says not safe for anyone under 21 or not for use, keep out of reach of children, things like that.
The Surgeon General also recommended THC caps at 5 to 10%.
Yeah.
And yet we're seeing sales at 99%.
Yeah. Yes. So I would, again, I would happy to send the public health framework, the list of policies, a THC cap, and products removing or not having products that are appealing to children. So the candies, the cookies, the gummies, anything with sugar. California just tried to do that. Colorado has tried to do that. Massachusetts is trying to do that. Those of us who are public health advocates are really trying to do that, and 10% THC. But I will say the NIDA defined dose unit is 5 milligrams. So I would caution you on the percentage piece because you've got concentrate, flour, edibles. And so in Massachusetts, even some of our commissioners thinks we have a cap. We don't really have a cap on concentrate because the percentage ranges so broadly, right? You can have 50% or you can have 100% THC, but you're allowed to possess 5 grams. So you either have,
We do have we have another witness that's supposed to testify, and the original goal of today's meeting is to start going through the working draft so we can at least kind of see what we have on paper and compare the notes on that as a commission. So we do got to keep it. I do assure that the Massachusetts model is not something that I would support, and it is nothing close to the policy that this commission is looking into. So,
Mr. Chair, I do have one more question for our witness. At the outset, you mentioned that the behavioral health community drafted a statement of concern. Is that, could we access that? Would you be able to send that to our?
I actually have a
commission members?
copy. It's not a formal copy. It's just a printed copy, but it's a copy nonetheless.
we can have, if you want, you can hand out the daily. We can get some copies made for the commission.
Okay.
Is Scott Gagnon here?
Thank you very much.
thank you.
Thank you for testifying.
Excellent.
And I know you've heard this already, but again, we're just asking for recommendations.
Yeah, no, I get it.
On, not that, I'm not asking whether you support any type of recreational policy, but if one were to happen,
Yep.
any advice on how to
I
implement that and to
totally,
mitigate?
totally understand the question. And actually, I'm a good person to speak to this question because I was in this position in Maine. So first, let me introduce myself. I'm Scott Gagne. I'm a certified prevention specialist. I've been in the prevention field for 18 years. I've been involved in cannabis policy and politics in Maine for over 10 years. And in fact, I was actually I led the coalition that opposed the legalization initiative in Maine in 2016. It was a coalition of public health, behavioral health, healthcare professionals, really broad coalition of folks that came out opposed to that. And if you followed the election in Maine, you know it was very close. Actually, I know the exact number, 3,997 votes between yes and no. It was very close. Because of that, I was afforded an opportunity to join a sort of a bipartisan, if you will, coalition of folks to come to the table to make recommendations because it did narrowly pass. It was going to go forward. So you had folks like me from the public health community, you had folks from the industry, you had folks from faith-based corners that were opposed to it. And we did make some recommendations, and I'm happy to go through some of the recommendations I would have. I do want to preface that, though. My experience in Maine is a lot of that work, unfortunately, was unraveled by a legislature that does not take cannabis seriously. And so that would be my warning, is I can give you a whole list of recommendations, and I will. I'll walk through things you should put in your bill. But if your legislature, and I don't know New Hampshire legislature, I'm just speaking of my experience in Maine, is there's not enough legislators that take all the outcomes and the risks that were just spoken about seriously. A good example of that is in Maine, we have two industries. We have a medical industry and adult use industry. The adult use industry requires testing, track and trace, all of that good stuff. Our medical industry does not. So we call marijuana a medicine in Maine, but we don't require testing of it. We don't require track and trace. And it's because the legislators don't have the courage to come forward and do what they know needs to be done. Everyone knows it's ridiculous that something that's called a medicine is not being tested for just metals, just contaminants, because legislators won't have the courage to stand up. That. So again, I'm going to walk through what I would recommend you do. But an important piece of this will be you can put forward the best legislation that's ever happened in this country when it comes to cannabis legalization. But if your legislature doesn't take it seriously and either doesn't pass it or waters it down or passes it and waters it down in the next session, I'm just kind of raising the warnings that you can put the best thing forward, but the work after it is going to be just as important to protect what you put in there. But again, as Dr. Turnquist said, I do have to be honest. I think if you come up with the best thing that's ever been done in the country, I don't think you're going to mitigate all the risks and the harms. So I would just say that. But so things you shouldn't do that Maine has done. To their credit, the Maine Office of Cannabis Policy, who is the regulator in our state, has in their mission statement that they value public health and they want to protect public health. Unfortunately, they have not walked the walk. We have in Maine, we had a Cannabis Advisory Commission, which I was a member of, representing public health. So the Office of Cannabis Policy wasn't really a great supporter of that. And through working with legislators, that's basically been killed off. So it doesn't even exist anymore. So that's one avenue that public health has had to have any kind of oversight on regulation as Maine was done away with. The other thing that happened to Maine, there was a question earlier about funding and funding going to prevention. Now, again, to our credit, and this was something I advocated for personally, was a public health and safety fund. So 12% of tax revenues go into this public health and safety fund. The original incarnation of that it was to be split between law enforcement and prevention. So the portion for law enforcement was for training, and the portion for prevention was for health education and et cetera, et cetera. When I advocated for that, the intention of that is that the public health money would go to an entity in state government that actually knew something about public health. But instead, it's with the Office of Cannabis Policy, which, they're great, they're fine people, but they do not have public health expertise. So the only thing that they've funded so far that's remotely close to prevention is a PSA campaign, which, as was shared, is really low. When it comes to prevention, really is not effective. I mean, I'm not saying you shouldn't do PSAs and campaigns. The science is pretty clear. They don't move the needle when it comes to preventing addiction. Young people, young adults, or across the lifespan. And so we've advocated over and over and over again that for the Office of Cannabis Policy to work with Maine CDC, the actual public health experts, to work with them to get that money into prevention coalitions and to get it on the ground in the communities to do the work, and they won't do it. They won't do it. Which is very, very frustrating. So don't do that. If you are going to put money into public health and prevention, make sure it goes to where it can actually be used in a useful way, to part of state government or an entity that actually has background and understanding of public health science. So, I mean, we've discussed potency. I mean, I think, most states have not done potency caps. I would highly encourage looking at potency caps. And as was discussed, the trick with that though is 10% again does seem to be sort of the cutoff. And in a lot of states, you're really hard pressed to find cannabis products of that potency or lower. So, I mean, addressing the potency is going to be an important piece. Other things that have happened in Maine is originally in our original legislation, we did not allow for delivery sales. We did not allow for vending sales. We did not allow for drive-through sales, but that is slowly starting to be watered down. So we've just allowed delivery sales, but we've also, the kicker with that is we're also allowing delivery sales to municipalities that have opted out or have not opted in to sales. So most communities in Maine have not opted in to allowing dispensaries, but because of this delivery bill that's passed, now deliveries can go anywhere in Maine, whether or not they've opted in. And so that's become kind of a way for the industry to do an end around of the wishes of towns in our state. So that's been an issue. The public health warnings on packages, something that I've been really frustrated with in Maine is, to our credit, there is a requirement for health and safety warnings. But unfortunately, when they do the rules and regulations for it, they said the minimum font for that is 6 points. So basically, these health and safety warnings are required on all adult use packages or hiding in plain sight. No one ever sees them. In fact, when I do presentations and whatnot, I do this little gimmicky thing where I hand out things in 6-point fonts to demonstrate how ridiculous that is. So I think that's important. But really, I can't stress enough. I think
If I could just interrupt you, do you know
Yeah.
the font on the side of a pack of cigarettes?
What's that?
On the Surgeon General's warning on a pack of cigarettes, what's the font size?
I honestly don't know off the top of my head. I feel like it's bigger than 6-point
Does
font.
someone in the audience know? Anyone? You have to just
It's got
5, 6.
Here's a package. I forgot to give the.
No, we don't have to hand the package. I'm asking, you send a font size. I'm just trying to.
I actually don't. I don't know that.
Forget the question.
I don't know the top of
It's
my head.
probably a 0.8, I would say.
I just think it's ineffective, right? I mean, it's a good policy. I mean, it's good that it's required. I just think when the rules were written, they're written in such a way that they can be hiding in plain sight. But again, I can't stress enough. I think the important here is, again, I can email you a lot of other recommendations. But if you have a legislature or if you have efforts to water that down or to not take this seriously, because that is really the biggest risk to our young people when it comes to cannabis. We don't have enough adults taking it seriously, whether it's in the legislature, whether it's parents and other trusted adults, whether it's school officials. There's this lackadaisical attitude towards it, like it's not as bad as a bunch of other things, but when it's perfectly been laid out why it is. And even until our adults and our legislators and what our governors take this seriously and convey that message, not just through what they say, but through the policies, and to stand behind them and to make sure that they endure, we're just going to be chasing our tails, if you will. So I would just again encourage, at the outset to have good public health experts weigh in on this and have a seat at the table. Not just one, but like many, do listening sessions, go around the state, get input from everyone in the public health community, and not tokenism, because I've seen that too often in states where if there is public health input, it's tokenism. It's one person at its seat. That's, again, I go back to the Cannabis Advisory Commission. I was the only person, I had the only public health seat, and I had to fight to get that seat, and then they just did away with the commission. So again, it needs to be meaningful, not tokenism input from public health. But then go into it with eyes open to know that the best thing that you put out still probably won't be enough. You should still do it, but and I can't stress enough, funding prevention, and not just PSAs. I think funding your prevention coalitions, because they're going to have more work to do when you legalize, if or when you legalize this. They will have more work to do. And SAMHSA, the federal government is not going to give them more money because they can't. They can't fund coalitions to do work with legalized cannabis. So they're going to have more work to do. So they're going to need more support from the state, whether or not they opt in. Because even though they don't opt in, there's still people going to be buying it and getting access to it. So I think investing in your prevention coalitions, because they know what to do. They have the science. They know what to do in their communities to protect them. So I mean, I'll take questions but again, my colleagues before me really laid out all the science. I don't really need to go into, but again, because my frustration in Maine again is just, it's been the lack of seriousness that the issue has been taken, and it's impacting young people. I mean, I could tell you all kind of anecdotes of families that have been impacted by this, going to the emergency room, getting suspended or expelled out of school. We need adults to step up and take it seriously now and in perpetuity, whatever that word is.
Good morning. Thanks for your testimony.
Sure.
Just a quick question. I didn't quite understand. You said the money is there in Maine to do the prevention, but they're afraid to use it.
Well, it's not being in my opinion, it's not being used properly.
Okay.
And I should so the original version of the public health and safety fund is 12%. 6% went to law enforcement training. 6%. They since have changed that language, so now it's no longer that 50-50 split. So it's a little looser. So it doesn't, half of it doesn't have to go to prevention. So that was one change that made it a little worse. But then even the amount of money that is for the public health prevention pieces, it's with the Office of Cannabis Policy, and they don't have any public health experts on staff. Where it should have gone, where I was advocating for it to go to, was to Maine CDC. It should have gone to Maine CDC because they can get that money to the prevention coalitions in Maine to do that work. Instead, the only thing that they've done is funded some PSA campaigns, which really just, science is pretty straightforward that has minimal, if any, impact when it comes to preventing addiction. So I think if even just made that change, if lawmakers or someone would come forward with a bill and says, go back to the 6%, it has to go, like, I don't know, 85% of it goes to prevention communities, like at a minimum. I think that would be a significant change. That's something I've been advocating for, but so far it hasn't really gone anywhere. So I haven't even gotten an answer to why they won't fund prevention. They just don't answer me.
Thank you, Scott, for your testimony. Prevention's work, and I laud you for leading that coalition. You know, that's really a near miss. So you almost got there. So, but that's a lot of
I didn't
hard
get a lot
work.
of sleep in the couple of years, I'll tell you that.
Yeah,
much.
you pushed the
I'm
boulder
a lot
uphill.
grayer because of it.
But the issue is we can't keep pushing up the boulder uphill prevention with the policymakers pushing back down on the boulder. And that's exactly what this process is designed to do. Even unintentionally, that's what's going to happen. Preventions is designed to prevent the problem from starting in the first place. And we do that by building protective factors and mitigating risk factors. This is, as I think Dr. Turncliffe said, one of the biggest risk factors that we could even be discussing in a state during a mental health and an addiction crisis. So
Can I speak to that just for a minute?
Yes.
So I just want to plug that SAMHSA, so that's the federal funder of substance use services, did come out about 2 years ago with an evidence-based resource guide for preventing youth marijuana use, 18 and under. And one of the sections in there, they lay out these specific risk and protective factors for young people when it comes to cannabis. And what you just said is in the sort of, there's different layers to this. So they have individual risk factors, family risk factors, school risk factors, and then like community risk factors. And when you look at the list of community risk factors, it's basically, actually I have it on my piece of paper here I can read off. So the community level risk factors for youth cannabis use are widespread availability of cannabis, greater cannabis outlet density, more days and hours of cannabis sales, exposure to cannabis marketing, youth exposure to cannabis marketing on social media, and products such as candy edibles that are attractive to youth. So just the very existence, and I hate to harp on this, but just the very existence of a cannabis market will be a risk factor. It's unavoidable.
Right, right.
All right, thank you.
before jumping in, the next item, I guess, we've heard from all three speakers is, thank you, Daley, again. So again, we've heard from our three speakers. I'm going to open up briefly for any public comment based on the three speakers that you might want input, because then our next step is to start walking through the bill and talking about sections in the bill. So is there anybody from the public who would like to speak and come up? Come on up to the microphone, sir. And just make sure you state your name clearly so we can get it documented. Great. If you want to pass it around. State your name for the record and go ahead.
Thank you. My name's Jim Riddle, from Hillsborough. I'm a USDA licensed hemp grower, and I'm offering my comments today on my own behalf. Earlier this year, and my comments are directly related to the charge of this commission. Earlier this year, I testified several times in support of HB 639. And when I did, since I'm a farmer, I was asked how many farmers in New Hampshire are interested in becoming cannabis growers. And I didn't know that answer. So I worked with the New Hampshire Cannabis Association, the New Hampshire Farm Bureau, NOFA New Hampshire, and several other farm groups to conduct a grower survey. 69 people took the survey. 87% of the respondents who currently farm, and the majority currently farm who took the survey, 87% support legalization, while 78% of those farmers expressed interest in becoming licensed growers. Only 11% of New Hampshire farmers support the state being the sole buyer and seller of cannabis. I understand that paradigm has shifted a little bit with the franchise model now on the table. The New Hampshire farmers who took the survey support allowing licensed growers to sell cannabis directly, with 70% support, 13% opposed, and 17% undecided. 89%. Yes.
So it looks like you're reading directly from your testimony, which has been given to everybody. We can all read. If you could
Okay.
maybe summarize and come out with the high points of what you want to talk about.
Well,
we can read the
if I could
details
just, this
in-
is the
in
last
commission.
statistic I want to present, and that's 89% of the respondents support allowing New Hampshire residents to grow 6 to 8 plants for personal use. And I'd like to shift gears now. During the last commission meeting, Senator Abbas asked the question, how can the draft bill be strengthened to minimize the illicit market? And I, over the weekend, looked through a number of scholarly articles, and the best one I found is from Washington State, titled Suppressing Illicit Cannabis Markets After State Marijuana Legalization. So directly relevant to the question that was asked. And if I could read a couple excerpts from that study, we found numerous factors in the competition between markets that may allow illicit supply of cannabis to survive. Many of these factors can be directly influenced by the regulation of the legal system. And things that impact that are the level of taxes, limits on cultivation capacity, and the burden of the traceability system. And to me, after reading those studies, it really is clear that how the regulatory system is structured really impacts the illicit market. And so, in other words, the more barriers to being a legal player, the more you're favoring the illegal market. I mean, and so some of the things I think that the commission needs to be considering, and I think this is number one, and that's in your charge, is to end prohibition. Because right now, people in New Hampshire are committing crimes by purchasing cannabis in neighboring states. There's already a thriving illegal market just because prohibition. But allowing home cultivation in every state that was looked at in the study allowed home cultivation. That really undercuts the demand for illegal products. And then the more people have access, the more it harms the illegal market. And you have to look at, why do people buy illegal cannabis? It's because it's lower price often. It's convenient that you can have somebody come to your house. It's a private transaction. You don't have to give your license number. And there's just a lot of tradition. People have been doing it in illegal states. So they have relationships. But if you keep the licensing fees low, you will, especially for small scale producers, you're encourage them to participate in the legal versus the illegal. And the same for the regulatory burdens. Keeping it simple, you want to apply and then remain in the legal system. So having user-friendly, standardized product tracking that it's easy to be legal and keep track of the products. And then a public education campaign on those dangers that have been talked about earlier by the presenters, especially the dangers of illegal cannabis, because it's not tested. There are potential contaminants. There is the possibility of arrest. Whereas legal cannabis needs to be tested not just for potency and terpenes and the qualities, but also potential contaminants. And that's contaminants like mold that was talked about, but also contaminants with illegal drugs like fentanyl. But I also listened to the comments at the last meeting from the Assistant Attorney General Madison. And Mr. Madison made it clear that a state-owned label, which is really what you're talking about, and then franchising the use of that label to retail stores would not isolate the state from liability or possible civil suits. But he also pointed out that Congress, through appropriations riders, has established a carve-out for medical cannabis. And given that reality, as well as the fact that New Hampshire does have a well-established medical program, I've come up with a novel idea, and I haven't presented this to anyone except my wife. And that is to build out New Hampshire's legal regulatory framework on the medical program that already exists, increase the number of licensed dispensaries, and add criteria such as insomnia, anxiety, appetite, self-care in order to qualify for a card. And the cards could be sold through the state liquor stores. So you're not taking the risk of selling cannabis or branding. You are selling cards. And the dispensaries could also sell these cards. And then, under this model, both residents and out-of-state shoppers could purchase a card for a reasonable price. They essentially, and then they could purchase tax-free cannabis in New Hampshire. But essentially, you're capturing that revenue through the purchase of these cards. You'd have accountability on who the customers are. You could do traceability of health impacts. You also can trace the products. And when a person would purchase the card, they would agree to follow all the legal requirements. They would agree not to provide cannabis to persons who are underage, whatever age you decide that is. They would agree not to drive while impaired. They would receive those warnings, not just on the pack that was passed around, but in that actual process. They would be warned about possible negative health impacts, including for pregnant and nursing women. And they would attest to hold the state harmless. So I think I know it's a novel idea, but I would like you to consider it because I think it can protect the state from civil suits. It will generate revenue without imposing either an excise or a sales tax, and it builds on a successful program that already exists. So thank you for your time and attention.
Thank you, Mr. Riddle. Questions for Mr. Riddle? Frank?
Okay, thanks. Just one quick question. Would you be willing to share the methodology for the survey and the questions you used?
Yes, there is and I'm not representing New Hampshire Cannabis Association. I put the survey together. There is a very detailed blog post on their website, nhcan.org, that shows graphs and the methodology is basically, I came up with a list of questions that had been, submitted to me when I testified, things that it appeared that legislators wanted to know. And we worked with New Hampshire Farm Bureau to refine those questions. Then, once we had it ready to launch, we asked Farm Bureau, NOFA New Hampshire, which is the Northeast Organic Farming Association of New Hampshire, the New Hampshire Herbal Network, Fruit and Vegetable Growers Association, a few other farm groups to help distribute it. It was open during about second half of August, all of September. We closed it September 30th. People voluntarily logged in to the website. It took about 10 minutes. They were able to both answer the questions as well as enter comments. And we will be sharing, the Cannabis Association will be sharing those comments. But that's basically the methodology. So it wasn't that we were calling people up, what's your opinion on these answers? It took voluntary initiative on the respondents' part.
Cool. Just one follow-up.
Follow-up,
So in terms of like how representative that, because it seems like 69 is a relatively small number. I assume there's,
Yeah,
I looked
yeah.
up quickly, there's like 40, at least 4,100 commercial farms in New Hampshire.
Right, and Farm Bureau has a membership of about 2,000. So yes, it's a small percentage.
Okay, and so we
I
do you know how,
recognize
like, how
that.
representative that
But
is?
we definitely had people motivated who were opposed, weigh in. It wasn't just targeting or anything. But it was voluntary.
Okay, cool. Thank you.
And there were several rounds of notices that went out inviting people to take the survey.
Further questions for Mr. Riddle? Seeing none, thank you, Mr. Riddle.
Thank you.
All right, so here's what I'm going to propose. We'll take a 5-minute break, so we're going to go take a bio break, and we'll come back. We're going to jump right in. Does everybody have a copy of the proposed draft language for the bill? If not, I'll get that out while we're on break. Yeah, I think there's copies in there, so I'll get them out to everybody, and then we're just going to start on page 1 and start walking through the bill. So 5-minute break, be back here at 11:35. So we're,
All right, we are back. All right, everyone ready to rock and roll? All right, does everyone have a draft of,
I gave it out.
all right, it's, when I say it's a draft, it's, again, nothing in here is set, but my goal is to kind of go through this by section. I'm not saying we're gonna do the whole thing today. If there's anything that's in here that is just, I don't know, we disagree on, whatever, but we want to make sure this actually can work in the real world. You know, I'm not going to necessarily accept testimony from the public right now, but, you know, a thumbs up or a thumbs down, you know, we'll exercise my discretion if we're going to allow comment on a particular section, limited to that. All right. So everyone have the draft? All right.
Do you want to tell the public for the record that we have in front of us?
It just says draft on it.
I didn't know if you took it from something.
It's not a previous bill that has ever been filed. So it's kind of a combination of several bills that have been filed. So to reference one bill number would probably be confusing. But this is what we got so far.
Okay, Mr. Chair, I did put out the extra copies we had. Every member got distributed one, and we put some extras out for the public to be able to read so they could follow along with our current draft.
All right. So
Mr. Chair, just a question. So we got some suggested language from New Futures. I didn't know if that was incorporated into this draft.
I don't believe so, but I didn't want to keep handing out drafts and making changes to the draft because there's no reference number to this.
Okay.
So it's not that I don't value what the New Futures input would be,
Yeah.
but I just didn't want to make any more changes since I already started circulating that. But when we get to the sections that would apply, obviously, please bring that up.
Okay.
So page 1, I think it's purpose and finding. Personally, I think you can just strike the entire first paragraph. I don't think it's necessary to make that finding, but you want to leave it.
So, Mr. Chair, if we're going to leave it, I do want to strike at least a couple words out of it.
I think the taxation.
I'm okay with the whole idea that we strike it because again, it doesn't have any force or effect of law. It's just more of a policy statement than anything else. So it's not necessarily means anything, but if we are going to do it, leave it. I want to strike the word law, after allowing, where it says law enforcement to focus on violent and property crimes, and just strike that and move on to the rest about revenue generation. My purpose in making, if we move forward with the legalization model, it's not because I want law enforcement to focus it, it's because we either think it's legal and we should do it, or not. But it's not about law enforcement focusing on violent crimes and property crimes. There you should be focusing on crimes, period. So I just want to strike that law enforcement to focus on violent and property crimes, because that shouldn't be something our state is looking to do, is have them focus on that. We should have them focus on just enforcing the law.
That paragraph is, and whether you agree with what it says or not, has no impact on the policy. So it just makes a long bill longer. And I'm just trying to cut this down. It doesn't mean that there's not good points in there. Representative.
Thank you, Mr. Chair. The reason I suggested leaving it in is from the comments that were made by the Attorney General, and that the state needs to document why it's doing what it's doing in light of a federal prohibition that exists. So you're creating a guidance, I think, where this, while it has no effect on the policy within the state, it does have a defense when you get into a challenge to the law, either at the state or federal level.
For my testimony, I don't know that the findings would have relevance for any federal enforcement action. It's really the underlying regime or compliance with that regime that may. To your comment about civil liability, for example, using that New York case, it's a preemption challenge, and so the state findings wouldn't influence enforceability under a federal claim. So I wouldn't want my testimony from last week to indicate that the documentation of a purpose is necessarily mitigates risk or legal risk.
Mr. Chair. Understanding what you're saying there, however, when other legislation we've had has relied upon findings in order to justify its existence, particularly when it comes to a federal level, and when you put down and saying that we're firmly placing the state of New Hampshire, in this case, in contraposition to the position of the federal government, you're immediately moving this to where eventually it's going to have to be resolved, because you're creating a jurisdictional point counterpoint in the first paragraph of the legislation, which would then allow somebody to go down to Washington and have some fun standing up and going, "Oh, you glorious people up there."
So let me just focus. So on that, there's 13 of us here. If you support leaving that that section in there, that's page 1, that's paragraph 1. If you want to leave it in there, and we can make some changes. Just if you support leaving it in, just raise your hand.
Striking it?
Just gone. And then again, I don't think that. I think, and then going to section 2, I think when it comes to section E, it says cannabis sold in the state will be tested, labeled, and subject to additional regulations to ensure that the consumers are informed and protected, and to protect the environment. That's section 2E. There's been some suggestion that maybe the testing is done by the state. I don't know if the state would have to do that themselves. It should be a private company the state can contract with. Generally, I think, I don't know if there's any comment on that or any direction we should go.
Mr. Chair. Again, I don't think that section E states whether it's state tested or an independent lab tested. I think by just leaving the statement in there, I think it's clear that testing's required, and then how we do the testing can be worked out. I'm assuming there's some testing language later on that talks about that. We can talk about whether it's an independent lab or a state-run lab. I think it would kind of be it would be, I hate to use this terminology, but the fox, guarding the hen house. We let the state test its own product and allow it for legalization for sale within its own facilities. I think we'd scream about that in the private industry, and I think we should probably scream about that in a state-run industry as well, that an independent outside lab testing is appropriate. So I would leave that as it is.
Mr. Chairman, we believe that, in point of fact, we do test our own products in this state. For example, blood samples for DWI is tested by a state lab. The chiefs, believe that this should remain in state. The testing facility should be a state-run facility.
I think it definitely remain in the state. It's just whether it's run.
No, and what we believe it should be a state facility. Yes.
I think with what Senator Lang said, that leaving it as it is, we can address that when it comes to the actual policy in the bill. For paragraph 2F, it says some tax revenue. I would just put some of the tax, just strike that out. So revenue generated from legal cannabis will be support programs and go from there.
Mr. Chair, I just wanted to also add a potential G that was recommended, which I think is a good one. Adding as G, the marketing and advertising of cannabis to minors shall be prohibited. I think, based on our conversation today, that's a minimum.
And you want to add that
To G. 2G, 1, 2G. 1, 2G.
All right. Does anyone have a problem with that?
Nope.
I think that's very reasonable, and they can recommend it.
Okay.
Can I,
Do you have this document?
I'll
They
give you my
passed around a
copy.
couple times.
I wanted to see raise its close and just see it. I just wanted to write down that section.
You have more?
I have them right here.
And just for the commission's reference, this is the document that I'm looking at. folks have this. The memo.
So is anybody opposed to adding letter G in that line about? Nope.
No.
We're good.
No one on the commission supports advertising cannabis to minors. Good.
We've
Make
reached
that clear. Is the
consensus.
press in the room?
All right, then if you go to line 34, page 1, it's the new subparagraph. It's, I think it gets into the substance abuse and recovery fund, management and distribution of the funds. Anyone have any comment on that particular section?
Mr. Chairman? Is that section, paragraph F you're talking about? Section F? Yes, para 2, section F. Could you strengthen that by changing will to shall?
I'm sorry, Chief, where are you at?
Para 2, section F on some of the tax revenue,
It shall be used as opposed to.
as opposed to will.
Anyone have an issue with that?
No.
So on page 2, lines 7 to, basically the entire page 2, it's the substance abuse prevention and recovery fund and management distribution of funds. Does anyone have any comment on that?
Yeah, so again, referencing that new futures memo, there was a suggestion to add treatment. So we would be adding treatment on line 5 in the title, so it would be substance abuse prevention, treatment and recovery funds, adding it in line 7, substance abuse prevention, treatment and recovery funds, and then again on line 12, shall administer the substance abuse prevention, treatment and recovery.
5, 7, and 12 to add.
Mhm.
You want to add substance abuse recovery treatment?
I think there might be one more space, and then line 14. So it's just adding treatment.
Does anyone have any issue with that? For all the treatment programs here, are these, any of these gonna be private treatment programs? Or are they all, it's all just gonna be,
This says, does it? None of this says whether it's state run or federal run, it's just that the funding can be used for it, so I assume it could be both, state run or private, treatment centers.
and how would a private treatment center get access to the funding?
Well, that's how they do it now, right? So they apply, an individual would apply to DHHS for under substance abuse and go to a treatment center, whether it's alcohol, opioids, or anything else, and they would be granted the funding. And DHHS has approved programs.
The how would be established by law.
Right.
Any changes that people see on page 2?
Mr. Chairman?
Would just the wording here that funds shall be deposited into that fund and distributed by the Commissioner, Department of Health and Human Services in coordination with the Governor's Commission on Alcohol and Other Drugs.
What's
Are
the
we
li-
saying the funding from whatever tax or revenue this bill would go into the Governor's Commission with the alcohol funds and then be, like it is now, and then be administered by by HHS? That's the way it works now. right now, the alcohol fund, the money actually goes to the commission. And then then whatever allocations they make to the HHS then does the actual funding.
The way I
Would
read
that
this, it would go into the same,
It's not clear here whether that's what you're
but
asking.
the way it's written on the second page, it looks like it goes to the same fund. And is there any issue on commingling those funds, I guess?
That's,
Well,
What line number you referencing?
So just in a title for the second, to ensure creation of a separate non-lapsing fund. The same oversight as the alcohol.
Mr. Chair, I would say from an accounting standpoint, the money, the revenues need to flow through the commission to the fund for auditing, from an auditing standpoint. So, because the commission will be in charge of the sales, just like we do with the alcohol fund. So much of that money from the revenues of the commission flows into the fund. So if we're saying the revenue minus whatever working capital the commission needs, the proceeds would go through into the fund.
Mr. Chairman.
Chief?
We're just a little bit concerned with the potential of commingling of funds. And we were wondering if we couldn't add something to the effect of a cannabis substance abuse prevention and recovery fund, an independent fund that would keep whatever funds come from sales, et cetera, separate and distinct.
Doctor, what line?
Yeah, so I actually was looking at the new futures, and it looks like they, when they're suggesting some changes, they actually didn't highlight an area. And so I was looking back at that, and that was, they're saying, insert at the beginning of the bill that in addition to treatment, to ensure creation of a separate non-lapsing fund for prevention, treatment, and recovery. That does seem like a reasonable idea. But so at the top here in the bold.
Okay.
Do you have one for the chair at least? It wasn't like the last. So, you know, what we're looking at is this memo. It's dated October 19th. There it is.
I told you I had it, I just.
There you
I'm-
go.
I'm trying to multitask, take notes. I need four hands to do what I'm doing, so I was trying to cheat off yours. Sorry.
You're doing a good job.
Oh, no, she kept telling,
She's tough.
she gabbled me down. All right, so we need to make have this be a separate fund.
A dedicated fund,
Yeah.
non-lapsing, a
Right.
dedicated non-lapsing.
Yes,
fund.
a dedicated fund
Oh.
with a similar objective, but it has to be separate. It also needs to pass through liquor for auditing
Yep.
purposes.
Okay.
Is that the consensus?
Yep.
I just want to make sure, the Governor's Commission on Alcohol and Other Drugs, they come out with a 3-year plan. And they have, as you know, legislative appointed members on there, and people from the subject matter experts, and they come up with a plan on what's best, how to use funding that they get from the alcohol fund. And I believe that the money should be put into that fund to be consistent. Why have two funds? I just want to make sure, why have two different funds to do the same thing?
Well, fundamentally, I agree with you, but I think there was concern about mixing the alcohol, that's revenue from alcohol sales, with revenue from cannabis sales.
If I think one of the reasons you should have something separate is the alcohol money goes to a few different places. This money would be specifically for cannabis, period. It would be specifically for the cannabis, non-lapsing dedicated fund. The alcohol fund now is used for a variety of purposes. We use it for the Medicaid expansion, which is a key issue, which I think at the beginning of the alcohol fund was never a purpose. So that's been designed, it's a new purpose that's been created, and it's quite specific, Chief. that it's going there. And I think that the flexibility of the alcohol fund is something that has been, the legislature has used on a number of occasions. That's all. I'm just pointing out that there is flexibility, there has been flexibility there, where this would be much more specific. If this would be a dedicated fund to one, for one purpose.
So if,
Mr. Chair, if I could-
if you look at the new futures,
Yeah.
what's here? I'm not gonna lie, I haven't read through this whole paragraph in a while. If you just cut that and put that in here,
But this, so this is, this paragraph is already in, and we're just adding the green, but then this is what they're talking about. That part.
So, Mr. Chair, if I can for 1 minute. So again, I tend to agree with David over there in that I'm not, just remember, we have a cannabis fund, which is the first segmentation of money, right? That comes from the retail stores and goes into the cannabis fund. It's from that cannabis fund that we then disperse the rest of the funds from. So in the case of disbursement, when we get down there, we send 50% to education in this model, which means we're now mixing cannabis funds with education. So why are we concerned about mixing cannabis funds with treatment programs? Because every person I heard testify, talk about treatment, didn't talk about treatment with cannabis alone. They talked about treatment in conjunction with opioids and treatment in conjunction with alcohol, treatment in conjunction with other, prescription drug medication, right? So again, I think treatment and not rehabilitation, but those other services are treatment, right? And so segmenting it out, I don't know that anybody's going to walk through the door and say, I just have a marijuana problem. And that's the only thing they have. And that's what this money would only be used for. So I think we better serve the citizens of New Hampshire by putting it into the treatment fund and allowing for the broad base of treatment and services, which would include alcohol and other opioid addictions.
She wants to, it looks like she wants to say something.
Mr. Chairman, I'm fine with the money going into the fund. I just want to make sure that the accounting of the money is separated in the liquor ledgers as separate funds. And if the money goes into a dedicated fund, that's fine. We, again, like everything else the Liquor Commission does, we're neutral on how you use the money. We just want to make sure the accounting process of where the money comes from and an auditing trail of where the money comes from
Mr. Chair?
and
is
if,
separate.
representative from New Futures, I know we've been referencing the handout that you provided to us. If you could just perhaps,
Well, and as a follow-up to this conversation, I wanted to know if this was added because of the concern that the alcohol fund is always rated. Okay.
No, I'm sorry,
Sorry, Kate Fry, Vice President of Advocacy from New Futures. I'm sorry I didn't explain this section well enough in the narrative for this. What I was pointing out is that treatment should be in that title because it's the full continuum, prevention, treatment, and recovery. But what I neglected to say is in our principles, what we have said is that the funding from cannabis sales, just like we have in the past with alcohol, should go to reduce the harms of an addictive product that first is on being sold in New Hampshire. So what we've learned from the alcohol fund, 20 years in the making, it was fully funded at 5% this year, 20 years after it was put into place.
It never has before?
It never had been funded before because the way it was constructed, it was often swept out during the budget process and used for other means. And so what we did this year, or in previous drafts of cannabis language, is we learned from the alcohol fund, and what we learned from actually the opiate abatement dollars that were coming into the state was to set up a completely separate fund in the Treasury that cannot be touched and can't be incorporated into the general fund. We merely just cut and paste that opiate abatement fund language, and we created this fund. And I agree with the commissioner, because of accounting with the liquor revenues, we feel that those funds should be separated but on the concern, why we have the connection with the Governor's Commission in their very important role of strategizing for the state, we do feel like they should have an understanding of how much is coming into the state through cannabis, through alcohol, and the larger strategic plan, and help advise where the funding should go in both of those pots, because they're in charge of the larger issue of substance misuse and have a say in that instead of creating a separate advisory commission. So two different funds, but a commission that is working with the department on the oversight.
One commission basically overseeing two different funds.
Yes, but with the larger issue of prevention, treatment, and recovery.
If it can be done with with that fund going, if the language could say that the Commission on Alcohol and Other Drugs would have the same, I don't want to say power, the same ability to be able to allocate those funds. And then I just want to make sure that that group is deciding where that money's going.
I think we can reserve making a recommendation on this, and perhaps we'll kind of consult with someone in DHHS on this particularly, and maybe we can talk to someone that's on the Governor's Commission on Alcohol.
It certainly was my intent with this language with the Governor's Commission on Alcohol, because they are the oversight of the alcohol fund. So that was my intent. But if we can tighten that up, I'm happy to help assist with
We're on
that.
the same page.
Yeah.
So, Mr. Chair, again, under section 3, it's pretty clear. Again, I guess this just creates two separate funds, keeps them separate, but still allows the DHHS to work with the Governor's Commission to deal with disbursement.
Yeah, and
Right,
this
so under section 3, so I think we're actually okay, even though we kind of talked ourselves into a circle. But I think we're actually okay. We can add the treatment language, because again, that is the specific under 12J, chapter 12J. It's the Governor's Commission on Alcohol and Drug Abuse Prevention, Treatment, and Recovery.
Yeah.
Right, so that's what, it's consistent with that, with their charge. And so I think we're actually okay. If we just add the word treatment in there, section 3 still allows the Governor's Commission to work with DHHS on disbursement of funds for appropriate programs.
So it's
Thank
fine.
you.
Fine is adding the treatment. Is that?
That really is all that has to be done, because that's from a previous, what you have, I believe in this, is from the previous draft.
Yeah, so it's on line 5, 7, 12, and 14.
Not to keep on talking about, I just want to make sure that the language is clear enough that these funds would work the same way as the alcohol fund, where it is the commission who decides where the money's going to go, and then the HHS then administer it. Here, it's not clear.
Just ask.
It seems to give the ability and power to HHS with input from.
I believe I copied the language for the Governor's Commission with the relationship with the alcohol fund. We can go back and double check, but I think I copied that language already in there. We can double check that.
And in respect to section 3 on line 21, if there's maybe a suggested language, we can present that at the next meeting.
But Dave, maybe if you could look at that and see how you want to rewrite that section, which talks about making distributions from the fund. So why don't you look at that and see if you can come back at the next meeting with language that would be suffice for the Governor's Council, for the Governor's Commission.
Thank you.
All right, so on to page 3, I think top of that page is just discussing the report that would be provided every 2 years, which is similar. That's done a lot of different, so we don't think we need to really cover that.
Actually, we have a question, Mr. Chair. So right now, it's the duty and responsibility of the Alcohol Commission to provide the report about the programs and the efficacy of those programs. So is our goal here is to move this over to DHHS now? Or is to leave that reporting mechanism in with the fund, with the commissioners? So it says a report on cost-effective and outcomes programs required under section, again, I'm looking at 12J5, commencing January 1st, 2020, and annually thereafter, the commission has to issue a report. So my question is, do we need to create another report?
Yep.
Because they're already talking about each report will contain evaluation of 4 programs, treatment programs, prevention programs, programs selected to be chosen from among the 10 highest dollar programs. So they already have a full reporting requirement for distribution of funds and the programs they support. Is our intention to create another report that they have to create?
I think as long as money's gonna be allocated to this fund and distributed with the discretion of, by DHHS, them providing a separate report on this fund, these funds particularly is important. Now, could that be merged into a report with alcohol? Can be, but I think it's a different revenue sources, so I'm not sure we want to eliminate it. Have a separate report. Anyone have any opinion on that?
Typically, what happens within, I can be corrected if anybody else, but typically what happens with the commission with alcohol and other drugs is that allocations on the number 5 during the contracting process, HHS will ensure that all these things happen when they contract.
Okay, so we want to leave it with DHHS for the reporting?
I believe so, yes.
Okay, that's fine.
I don't want to put words in their mouth, but they
No.
typically do this during the contracting process.
Anyone else, have any objection to leaving the report being prepared by DHHS? On page 3, it talks about lines 6 to 9. This is actually a problem. This is a problem in existing legislation where, a valid passport, the bold would be added, but it's by a country with whom the United States maintains diplomatic relations. It was always believed that was a drafting error, that the United States passport wasn't an appropriate form of identification for alcohol. They've been attempting to fix it in every cannabis bill, not a standalone. Here it is again, but it would be no explanation why you can accept a passport from Ireland or England, but not a United States passport in America. But that's how the law is written, so. But does anyone have any problem with the United States passport being a sufficient form of identification? Purchase liquor and cannabis for that matter? None? Good. Lines 11 through 17. I will say, before we get into the policy of the forfeiture fund, this has been that has been a separate hot topic issue in the legislature, and perhaps just striking that out for the time being and not dealing with the drug forfeiture issue, that can sink the ship, if you know what I mean. Does anyone have any objection with that?
Your recommendation is to strike section 5, starting on line 11?
Yes,
I support that.
and I'm not commenting on the policy either way. I'm just explaining that policy is worthy of its own debate, separate aside from this. I don't know if anyone has any disagreement with that or.
So eliminate forfeiture.
Well, it's not eliminating it, it's just not modifying the
Right,
current
eliminate
language.
right.
We all in agreement on that? Anyone? No? All right, good. On lines 19 through 23, any issue with the language being added? I think they might have left out the word harvesting or cultivating, but you want to add that to it? Is just cultivation enough, or do we need to add cultivation and harvesting?
Well, what's it?
I'm fairly confident the same thing, but you never know when it comes to legalese.
It's a taking.
Picking.
So just add the word cultivation after,
Cultivation and harvesting. Or we just,
Once you harvest your possession of it, you'll recover it.
Any objection to adding those two? Okay. Now we're in the definition section. It starts on line 31.
Chairman?
Yeah.
A question?
Sure.
If this should become law, if legalization becomes law, will we even need Roman 1?
Yeah.
That's a good question.
I'm sorry, what was the question again, Chief?
Well, if the legalization becomes law, do we actually need alternative treatment centers any longer?
Yeah.
So again, I don't necessarily think we need the definition because we're only referencing another definition in, in law anyway. So I'm not sure that it serves any purpose. So it may, if someone's looking for the definition within the statute, they can go to the definition section, and find where it's defined, what is the definition. So I don't think it hurts having it in there, although I do think that we're still going to have medical dispensaries and alternative treatment centers. So I think we leave it in for that reason.
That's exactly correct, because if you have a reference to it in the law, you have to define it in the law.
Yes, he's correct.
Thank you.
He's two in a row. He's on a hot streak.
You don't want to run too strong.
All right, so we can leave the definition on line 33. Now, line 35. I wanted to make sure that this is not regulating CBD extract. That's its own right thing. Now you can buy that. Right now you can buy that in a lot of. You can buy that in a lot of different stores right now without a license. We don't want to require a license for just someone buying CBD oil.
Do we want to put that phraseology in there? Does not include blah, blah.
I agree with Representative Ullery. We have to make sure we protect those stores that are selling the stuff at like spas and stuff like that. And there's creams being sold they're important to people. So
Does this definition accomplish that as it's written?
Yes, but.
Seems like it might be helpful to be more specific. Just say that this excludes CBD only products.
Yeah, that could be included in the last sentence.
So
Or other product such as CBD oils or CBD products.
derivatives.
So I will, Mr. Chair, I think you and I had a brief conversation about this, or I sent you some emails on it anyway. CBD is going to be an interesting conversation point right now, because it's being pushed in a lot of places, and now we have conflicting law happening. The city of Rochester shut down a CBD coffee shop because technically, according to the FDA, CBD is not an approved product for the inclusion into a food product, and so it's creating some spot enforcement, for lack of a better phrase, that's going on. And never mind, I just came back from Las Vegas and I attended the National Beer Wholesalers Association. CBD drinks, whether alcoholic or non-alcoholic, are starting to become all the rage in all the states that are not regulating and dealing with this issue of CBD and THC infused other products that may be food or otherwise. So again, I just caution that by not taking a stance, we're leaving conflict out there that's pending.
So they shut down the coffee shop serving the food that won't make you impaired, but if you buy it in a candy bar that will make you impaired, it's fine.
I'm just making a statement that
right.
again, we have this conflict of CBD and a hemp-derived product that people confligate with THC and low potency THC products. And what does that mean?
we definitely have to protect the spas that are selling creams and stuff like that. I mean, that's CBD,
Yes.
but they're not ingesting that. So
I'm sorry, say that
that's like not a food.
And is there, we have a doctor on the, are you aware of any different effects of CBD health benefits if it's ingested as opposed to used in whatever he just, does it matter? Does that really matter? Do we really, it seems that we're over regulating that. If there's no.
Yeah, I
rational
mean, I
purpose.
think that the only thing that I would say is if we're ingesting it, like was brought up by some of the presenters today, is that a lot of the products, as it's unregulated, do have THC in them, and that gets a little bit tricky. Like if you test what's out there, like at the co-op, like 10 to 20% of those products do have THC or would show up positive on a drug test, which makes that a little complicated, I think, when you're ingesting it. But yes, I mean, so just the product being different vectors are absorbed differently. So a topical would be absorbed differently than an oral tincture or something like that. So I think it is different. Doesn't matter. I don't I don't know, but it definitely is absorbed differently.
Well, I suppose what we can tackle that inconsistency at a different time. It seems to me that but we want to keep those products that are being sold now still continue to be sold as they are. Is there, I know our friends one of our friends from Maine is here. He's at my 12 o'clock. Have you seen the definition that we're referencing? Do you understand what definition we're referencing? Does someone have a copy we can use? I'm just wondering if you can offer any comment on that particular definition, and if there's any problems with it.
Mr. Chairman, the paragraph 2, Roman 2, it talks about topical or oral administrations. Now, it does not talk about food products. Food products is a different category. And the store in Rochester was manufacturing or selling a food product that was contaminated by CBD oil. So it was a contaminated food product. That's a different section altogether regarding law. And again, that's outside the area. What we have currently being sold are CBD products, direct products. Those products are not, what's the word for? Topical. Well, they are topical and they are oral, but they're not food products. So they're not, they ain't food. So if we want to put food in there someplace, that just gets rid of that issue entirely.
How would,
There is a federal definition.
Mr. Chairman, how would that account for like what we're talking about with the coffee? Like I know the coffee shop in my town puts the CBD if you order that in the coffee, but it's because they're separate items.
You know, I'm getting shut down. Be careful.
I didn't say where I live, right? But right, so like if they're separate products, but it's being introduced into another product as opposed to like ready for consumption. I mean, is that different?
So, again, there's a federal definition of cannabis, if anybody wants to hear that, but I don't know where, if we want to look at other states' definitions and come back to this discussion.
So CBD oil product, everything is legal. You can buy it right now at a variety of different types of stores, all right, or businesses. We don't want to change that. All right? No one's getting impaired from CBD if it's just CBD. So I want to make sure that this definition does not disrupt what's existing now.
Well, but if I may, what I heard from the doctor is that things that say they have CBD in it are testing with levels of THC as well. Is that what you said?
Yeah, that's correct. That's what the data shows, and that's what they presented today, is that there are, even if it's labeled as something that you can buy at the co-op as CBD only product, a percentage of those do test positive for THC.
Now, by testing positive, do you mean like traces of it, or is it something that you would actually make it?
If it's 0.03% or less, it's not considered cannabis. Okay, so that's why. So the law here, our consensus is we need to look at the hemp law that we have in here. It has, some of that has to be integrated into here. Okay, and the other thing is seeds in the definition of cannabis. The DEA said seeds, we can send those to the mailman. They're not technically cannabis.
So, but then wouldn't, if that's the case, wouldn't seeds then be unregulated and impossible?
Well, they are. We can send them to the mail.
So, so what I would say when it comes to perhaps enforcement, if you're gonna be tracking the seeds, I don't seed to sale, would that would we need to keep that language, this word seeds in there? I'd rather keep it in and take it out later than take it out now and wish we kept it in.
I
My
agree.
take, but I'm not sure I'm correct in doing that.
I think that would be the safest way to do it, and the majority of the finite definition of what we're speaking about would be covered in rule.
So in respect to this paragraph that we've been, is there any changes though that we think should be made to it? I know there's a suggestion of striking the word seeds, but does anyone have any comment on whether we should do that or not? We can,
It feels like this is a larger, I mean, we could spend however long, it feels like we need to come back to this. I don't know if, what the chair's intention is of, you know,
if you want to revisit, let's say we agree to keep it in, and then next meeting you say, oh, here's the information, let's take it out. This is not set in stone. It's just, if we come to a consensus on something, you know, I think the public can hear our reasoning. There's a lot of people interested in what we're doing one way or another. But it's not like it's binding on anything. But I say we leave it in for now, and if we want to discuss taking it out at next meeting, you can, Representative Kale?
Yeah, I mean, my whole point in like saying what I was saying was that I know lots of spa owners that sell creams, and I don't want to see their businesses hurt. I want to see them still be able to sell their creams.
And perhaps if we can have some suggestive language on to make sure we're not inadvertently making some lawful businesses that are operating lawfully right now require licenses, to make sure we don't mess that up. In regards to accessories, any issues with in the language there?
Mr. Chairman? Sorry to take us back, but I wanted to look up one section. This is on line 22 on page 3, back to the definition of illegal drug. And so I just looked up 318B2, which includes the acts prohibited. And so our list of exceptions, possession, use, manufacture, sale, is not fully inclusive of all of the things here, like they have under their control, possessed with intent to sell. Like, I'm wondering if we should just mirror the language to make sure that all the exceptions are in there.
That makes sense. No, I agree. We want to have consistency, so.
Yep. So sorry to bring us back. I just didn't have it up right away.
Now, wouldn't we want to just kind of what we did with the first definition of alternative treatment centers? We reference the RSA, and then we can cut and paste that same language. Does that make sense? And what's the RSA you were referencing? Any problem with that from anyone? Any objection? I think it makes the language consistent and stronger. So. Thank you. In respect to accessories, any comment on?
Mr. Chairman. Just one quick comment, and I'm not sure this is the correct place to put it in, but we have to make sure that we have a lot of businesses out there now that are selling accessories that are not going to be levied the 15% percentage that the Liquor Commission will ask for. So I think what we would want to do when and if we have our outlets, we want to make sure that the revenues from the accessories are not put into the taxed portion of the revenue, because I think it would then be unfair to have some people taxed on selling accessories and others that are not. So I think that we would want to make sure that the accessories in the outlets, when and if the language is passed, are exempt from the 15% franchise fee. Other than that, you'd have some businesses in the state that are selling those products that aren't being taxed and some that are.
Anyone have any comment on that?
I would agree with my colleague that that would create an unfair burden upon businesses that are already selling those items.
So I think if you're, let's just say you're selling, the whatever pipes and whatever that's you want to call that store, right? They wouldn't be subject to any franchise fee. So I guess the question is, if a franchisee inside their store elected to sell the pipes or whatever the paraphernalia is, would the stuff sold inside the franchisee store be subject to the 15% royalty?
It shouldn't be.
I agree.
It's simply drawer 1 and drawer 2 in your POS system. So if you're selling paraphernalia items, it's not being taxed on the grand sale of your retail. Just the cannabis items are being taxed. Other than that, you're creating an unfair advantage for the businesses that are in place now, or a disadvantage if you now choose to tax them or levy the franchise fee with them.
Mr. Chairman, do we know how other states are doing that? Like, does Massachusetts tax paraphernalia, things like that?
Sorry, repeat that.
I was wondering how other states were handling paraphernalia sold in their stores. Do we know if they're imposing higher tax burdens?
Well, I don't know what every state's doing. Some states just have a general retail sales tax. My thought was, the franchisee, if you choose to buy your paraphernalia from there, you're already there. It's the choice of the consumer. It might be cheaper to go to another store, but I don't think the retail stores are relying on their paraphernalia sales as their big moneymaker. But I see some folks in the industry are come to the microphone if you don't mind, just and introduce yourself for the record, and the gentleman, come up as well.
Hello? In Maine, right, in our stores, we sell clothing and we do sell some paraphernalia, although it's not a big thing, it's more of a convenience thing. We charge Maine sales tax on any cannabis product, but we do not charge Maine sales tax on any paraphernalia, any clothing, and I believe CBD products, if it's just CBD.
But isn't there a general retail sales tax?
10%.
So wouldn't that apply to the paraphernalia?
It doesn't apply to if you come up to the counter and you're buying from us and you have a shirt, you don't pay tax on the shirt, but if you buy flour, you pay tax on the flour. So we tax them on the flour, but not on the shirt.
But take cannabis out of it. You go to any type of retail store. Isn't there a broad-based sales tax in there?
Okay, yeah, yes. The main sales tax, I think, is 6%.
So they would pay
But
the 6%.
but the cannabis tax is not applied to it.
The cannabis tax, but the broad-based sales tax would be applied.
Correct. If you have New Hampshire doesn't have one, but in Maine, yeah, we charge 6% on top of that. But in Maine, we charge 10% on cannabis and then 6% just general sales tax. That's how it works.
If I could, two quick comments, Jim Riddle again. on your definition, I do believe, I don't have it in front of me, but you include the word license in that definition of accessories. And currently, stores sell accessories without having to be licensed. So I don't know if that's an inadvertent inclusion of a word, or if you're thinking of considering an entire paraphernalia licensing system. So
Mr. Chair, if I may.
is that correct? It does currently
So,
say license?
Again, to try to, I tend to agree with the fact that we shouldn't be charging a tax on the product, on the non-cannabis products. And so I think number 4, I didn't see anywhere we actually have a license for a cannabis accessory reseller anywhere in the bill. So I think that number 4 is probably a leftover from somewhere else that did have it. So I think we should strike number 4 and under, I'm going to jump ahead a little quick. 'Cause
Before when it comes to striking number 4, are we all okay with that? Or anyone have any, I'm not saying you approve of the policy, but just
4 would be cannabis accessory retailer means an entity licensed to sell cannabis accessories and paraphernalia.
Yeah, we don't have a license for that anyway, so it doesn't matter. So
That's my point. And then just one final thing, on the question of seeds being in the definition of cannabis, I will send to you the DEA determination letter where they specifically say seeds because they don't contain THC are hemp and not cannabis, regardless of their genetic potential. Thank you.
the last thing I'd say, Mr. Chair, when it comes to this taxation, this question is, I'm going to jump ahead real quick to page 18, where we talk about taxation. And I think we can just fix this by adding the franchise fee on a franchise fee on the monthly total gross revenue, less cannabis accessories. And that solves the problem. We're not taxing accessories at that point. We're done. We define what accessories are, but we're clearly saying that it's not a taxable event, whether you're a licensed franchise or an individual. That should solve that problem.
I can step up.
Sure. So does that make sense to everybody? So I made a note, we'll add that in, but, so we're gonna strike section 4, we'll leave section 3 as it is, and we strike in the future language that accessories are not gonna be taxed.
Yeah, and use the same terms, right? Cannabis accessories.
Yes, yep, use the same exact, that definition of 3 will be used, that language in the taxable language. All right, moving on to number 5. Any questions or discussion on number 5?
Mr. Vice Chair?
Yes.
I'm wondering if, is the plan to go through every definition, or do we want to go, like, do folks have comments?
Well, I'm
on
gonna
the
just step
definition
through them,
section?
and if nobody has any comment, we can quickly move past it, right? Just to make sure we address. So no questions on number 5, no comments on number 5?
I have a
no-
question, Mr. Chairman.
I'm sorry.
Question.
Yes, Chief.
Should we add in 5 and actually some of the subsequent paragraphs as well, a licensure itself? For example, cannabis facilitation, cultivation facility or cultivation facility means an entity registered, and add and licensed by the state of New Hampshire? Or are we just registering these endeavors?
So I think, Mr. Malika, we talked, those are licensed entities anyway, so we could just change registered to the word licensed and be done with it, and that clarifies it. Everybody okay with that?
Thank you.
So on number 5, line 8, at the end of that sentence, we're just going to change registered to license. Any further discussion on 5? Seeing none, moving on to number 6, cannabis establishment. Any questions here?
Once again, just for clarification, do we need to be more specific and indicate that such establishments are licensed? For example, again, cannabis establishment means any licensed New Hampshire cannabis cultivation facility, et cetera. Do we want to get that specific?
It's included at the end of that definition and licensed by the commission.
But that's reference to the last clause, or any other type of cannabis business license and commission and license. So that's just to that last clause. So the and license, authorized and license doesn't apply to the beginning of the sentence.
We could add the words including something like that including and or any other, you know what I mean?
So here's what I recommend. So we don't have to do license through this whole thing for each one of these commas that are in here. So how do you feel about, we just put a license established, a cannabis established means a licensed, and then I'll just number A, B, C, D for each one of the facilities. So it means that all of these things have to be licensed that are in there because it applies to all the subparagraphs. Does that make sense? And just break that
Yes.
down so it's clear that it has to be, what discuss, a cannabis establishment in this chapter means anybody who's licensed.
Thank you. Thank you.
And that clarifies that. Number 7, cannabis product manufacturing facility or product manufacturing facility definition. And again, I can do the A, B, C, D if you want on this one as well, because we do have a bunch of commas in there. And to Senator Whitley's grammar police, the license will only apply to the first,
I
to the
will
first comma if I don't put if we don't modify
I
it.
will say that it came up because I'm teaching statutory interpretation at the law school, and that issue about, what it applies to is deeply discussed. The other lawyer in the room is nodding.
So we'll do the same thing. We'll do an A, B, C, D on that one to talk about each one of those. License to A, purchase cannabis, B, to manufacture, prepare, package cannabis, and C, to sell, blah, blah, blah. We'll do a bullet point for each one of those after the word license, just to make sure it's clarified that license means all of these things, not just the first comma.
I missed the first, I had no idea.
Just say yes.
What did everyone else say? If my number doesn't matter.
No, so we're moving on to number 8, cannabis products.
All right, so, all right, I'm back.
Page 4, line 26.
We're walking through the definitions, each one.
You're doing a good job. Keep going.
So number 8, cannabis products. Any questions on those?
CBD in there. The last shall not include. That way, what you're doing is you're making it.
Isn't CBD a cannabis extract? Am I wrong when I say that?
I believe it is, but we have to definitely protect these already established businesses.
That's what people, I think the easiest way to do that is to, so what a cannabis extract is CBD oil. We can say, keep the word, cannabis extract excluding.
So here's the
CBD.
interesting, so they have,
Right.
this is where we get into a little detail about what a CBD and certain concentrations. We heard the conversation earlier talk about low potency products under 3%, right, is a low potency product and not considered to be cannabis for the purposes of a lot of other statutes. But above that threshold is considered to be a cannabis product. And so how we define that might be interesting in here. So if we want to talk about low potency and create a definition for that so that we can say that low potency products are or are not regulated, I'm not sure how we want to deal with that. But again, the Delta 9, Delta 8, Delta 10 THC products that can be derived out of CBD oil, right, through a chemical process and have potency within a CBD product that was defined from hemp becomes problematic. So there's a gentleman in the audience that wants to speak and talk to that.
Question.
What?
Or when am I gonna throw it away?
Well, hold on a second. If you can approach the microphone, that would be, and just say your name for the record.
One of the things that we noticed when we were reviewing this, and then I heard today, you're talking about low potency of like 10%. I'm growing a plant, right? So I send a plant into the lab to test, and first of all, 10% is not even realistic. We don't even grow 10% strains anymore, okay? But let's say it's above, what you guys put is the potency. What am I supposed to do? Destroy it or run it into oil? I can't do that. It's not like we tell the plant how much THC is going to be in it when it comes out the end and we have it tested. But I can assure you 10% is not close to where you have to be. It won't work.
Well, again, but I think the definition here is to what we're going to exclude from the definition, especially after manufacture. right? So again, it's about after manufacture, what we're gonna exclude from the definition. Correct. So,
All right, Dr. Youngren and then Chief.
So a question, the vice chair was saying, are we talking about low potency cannabis products or are we talking about hemp? And I think we need to be careful about not interchanging them. So if it's less than 0.3 THC, then it's hemp. If it's greater than that, then it's maybe a low potency product until we get to another threshold. But if we put the definition of what is considered to be hemp, and maybe that would take care of that.
All right, so if we add a sentence, basically anything that's, currently under the definition of hemp shall not be fall in this definition. It might be too broad, but I think erring on the side of caution to not require every vitamin store to get a license. That's gonna take.
Right, but I don't think, I mean, it currently, you technically, if everything is as marketed on a container, you can't get something that's above 0.3% currently outside of an ATC. So if you went to the co-op and bought it, there shouldn't be, at least it's what's currently on the label, rather not that tests out as different, but I just wonder if we're not specific, it seems like it could be a problem.
Any recommendation? We're not gonna hold you to it. We know we're putting you on the spot. and we
Yeah,
also
no, I
have-
mean, I think that if 0.3 is what the federal government recognizes, we put that there very specifically, then that should in theory cover everything that's legally being sold in retail stores currently.
so Doctor, would you mind taking this as a homework project and rewrite this definition and bring it back to the next meeting so we can take a look at it and
Sure.
evaluate it?
Don't be late with your homework either.
And we definitely just want to make sure we protect those.
Yep.
So,
So Dr. Youngkin, we'll expect next meeting, you'll have something to review that.
Mr. Chairman?
Next up is cannabis retail.
Chief,
I may have
Yeah,
lost
Chief.
I may have lost my place. I apologize. We still on paragraph 7? 8 rather?
Yeah, we just, the doctor was gonna
All
do a
right, okay.
review of what low potency means and that kind of thing to make sure whether it's covered or not covered as a cannabis product.
I'm just wondering if there's a reason to include edibles in that, or should that be deleted?
So my guess is that as we look further on, we're gonna have a definition of what's eligible to sell, and I think edibles are gonna be one of those definitions. So we don't include it in the definition of what a cannabis product is, it would be excluded from the sale process later on down the road.
Thank you.
Again, I'm sure the doctor who deals with that kind of language on a regular basis will address it accordingly in her definition. So moving on to number 9, cannabis retail store. And I will say I have an issue with this one, and it's only because it's also in relation to number 16, where we have 2 different definitions. I thought we were consistently saying that an ATC, if it wants to open a franchise store, would be separate from the medical dispensary. And so I'm not sure why we have 2 different. We are in the bill, we're allowing them to turn to for-profit, which would allow them to become a franchise store. But the franchise store has to be separate and distinct from the medical store, so we don't have a deal of taxation issues and 2 masters with 2 agencies controlling the same facility. And so I thought we were clear on that, so I'm not sure why we have 2 different definitions.
I will tell you, well, may have been written before that.
Right.
Things have evolved since this began its circulation, but my understanding is, so the alternative treatment centers, they have the choice, they can remain as they're operating now. If they wish to engage in the retail market, they can choose to do so, but to have both signs on the store and just trying to figure that out, it's not gonna work.
Well,
think-
I agree, and that's
so-
why we don't have 2 different definitions, right? We have a definition that's you're either a retail store and you're following the controls and conditions of the liquor commission, or you're a medical dispensary in which you fall under controls and conditions of DHHS. And there's no 2 masters involved in who's regulating signage, who's regulating labeling, who's regulating all of that, those 2. So my recommendation is to strike number 9, and on number 16, strike the last sentence. And that allows the ATC to become become a franchise store. If they choose to, they can either, they can open a separate location with a separate, that's all under the controls and conditions of the liquor store.
I support that.
And, all right, so.
So we're striking number 9 altogether
And, yeah, 'cause
and
there was
striking the last sentence of number 16, that they're not prohibited from becoming a licensed.
Page 5, 11, line 11 and 12.
There was also an issue that number 9 had the cannabis paraphernalia in there again, so that would have been required.
So,
All right. Anyone have an issue with what striking paragraph 9 and then the last sentence of paragraph 16?
number 10, cannabis testing facility or testing facility.
So this was what I was talking about before. Do we want the state to run the testing facility themselves, or we want a private facility? We can have a little bit of both. I don't know. I know, Chief, you suggested that the state is capable of doing it. That also means the state would absorb the expense. If it was private and you required the franchisees to do it, that would perhaps pass the expense on it. And it doesn't mean that the state couldn't come in and do some testing as a kind of an oversight capacity. But I see our friend from Maine and
Jumping with that.
and someone who's appeared, testified about cannabis millions of times.
Thank you, Mr. Chairman. For the record, again, Matt Simon, Granite Leaf Cannabis. Just a brief comment on how other states have dealt with this. There are currently no states that,
How do you recommend? What's your recommendation?
I'll jump to the chase. My recommendation would be a system that relies on private testing labs, and the option would be to have a state testing lab that audits the private testing labs. So this is the issue that they had in Vermont. There weren't enough testing labs, and a product did make it to the shelf that hadn't been tested. The state didn't have its own lab and the ability to recall that product and test it. It also provides oversight in case there's an issue with the lab maybe not providing accurate test results. This is a way for the state to immediately be able to test a product itself and spot check to make sure the independent labs are doing it.
Thank you. Our friend from Maine is shaking his head yes, which means he likes what you said. So, question, Chief, do you have any comment on that? I'm not holding it to, I mean, is that?
No, again, we would strongly recommend state, but I suppose if there has to be a compromise, that might be a viable one.
So basically, the state would be able to audit any results, and they could even perform their own tests if they chose to do so, but it's passed on to a private business. Is that, Liquor, have any comment on that?
I think that the best way to do it would be to have private labs test it. And if we wanted to have a backup system in place, that the state would do it, but we certainly would need to talk to the department. We don't want two things. I think from a business standpoint, we don't want it to be cumbersome for the product to get to market. So if it's an alternative, then we would be in favor of that. But I certainly don't want to.
Yeah, we don't want to speak for the Department of Safety because obviously that would be the lab facility that would do the testing. So, I don't think we would want to talk about what testing the Department of Safety.
We also want to overburden the Department of Safety's labs testing this versus.
Yeah.
So again, Mr. Chair, going back to the definition, I think this allows for that, either a state-run model or a third-party independent model. And it would also, depending on the regulations, when we get into testing, which I think is in here, it would allow for either the liquor to require, to say, we're going to take this product and we're going to go to a different testing facility, licensed testing facility, have them test the product to verify the first testing. I think, again, that's going to fall underneath the regulation aspect of this and not necessarily the legal aspect of the law aspect, right? It's going to be in regulatory requirements.
And Matt, Simon, if you don't mind, you mentioned what another state did, I think Vermont. If you can provide the commission that definition, that would be greatly appreciated. But I bet you're well informed enough that you can help us with that definition.
Next up is number 11, cannabis transporter. Any conversations around here? Again, this is a licensed entity.
So if if you're if you're an entity, right, that's cultivating, but you're transporting to your own retail store, you have to have a separate license to transport it from one to the other,
Yes.
specifically for transporting cannabis?
One involves a DOT, right? Over
What's that?
DOT, it's over the highways.
Well, again, I think the idea behind here is about, again, in every step of the process, we have control and licensure happening. So there's no unregulated, unlicensed part that's happening in between. So from the time you go to cultivation, you move it to manufacturing, the person that moves it from cultivation to manufacturing must be licensed unless it's, assume it could be within the same facility. If the cultivator also had a manufacturing license, you're moving it from building to building and that's on your own property, it'd be okay. But if you had to move it from Keene to Portsmouth for manufacturing, then that transportation would require, that person would need to be licensed. And then if you're moving it from the manufacturing facility to the retail store, again, that person would have license. So you have a complete closed loop on from seed to sale.
I was getting at the point, if you're a cultivator and a manufacturer, and you want to ship it to the other stores, you need an additional license now to transport it. Even if you're also the retailer, you're basically, I know there's separate entities sometimes, but it's same guys operating everything, right? They couldn't have, I guess, a manufacturer or a cultivator can't have an in-house transportation.
Mr. Chairman, I don't think it needs to become a burdensome process of licensing. I think to the senator's point, it's just that seed to sale process and where the product is going. And I would also add that from our standpoint, from a retail standpoint for the state, we would want to make sure that the manufacturers and the growers had the ability to do this to keep the costs down.
And I know with alcohol, we have a really good system in place when it comes to distribution, so.
We have one distribution system, one warehouse, when it comes to our alcohol.
So any change to that definition? Good.
Number 12, commission means the New Hampshire Liquor Commission. Agree with that? All right, that was an easy one. Number 13, consumer. Any discussion around the definition of consumer? Seeing none?
Well, there was one discussion we had, somewhat off record, but if we had the retail product and rather than have separate ATCs, they have their branded product, and they could then we could create an opportunity where they can sell their therapeutic grade product in any retail store if that franchisee wanted to adopt that policy. If we did that, it would be sold only to people who have the therapeutic card.
So you're talking about mixing medical into the retail store?
So let's say all the ATCs became adopted or opted in and were granted a franchise from the state. The issue is their branding would essentially, at least as from a storefront, go away, but they still have the products that they're manufacturing and cultivating, right? Now, I presume they would likely continue to sell those out of their own now retail store, but what happens to the therapeutic system? The idea is you can still have therapeutic grade products, but then maybe permit them to, any franchisee be allowed to sell them provided the person had the therapeutic card. It does, you don't want to have the unfair market advantage where some franchisees have therapeutic products and some don't. But would we want to?
So again, this goes to the commingling of regulatory requirements, right? So my inclination was anybody who chooses, again, it's a choice, to put up a retail store be subject to the rules and regulations and conditions of the Liquor Commission. And so if the Liquor Commission approves this moving of their product into that store, again, all the branding and labeling is subject to the Liquor Commission.
Correct.
Right?
And the therapeutic, the ATCs would then fall under the regulation
No.
of liquor as well. if you
Their
wanna go there.
retail store operations would fall underneath liquor, not their medical distribution product.
As it's written, that's what you're right. I'm proposing that we.
I don't want to cross-mingle that.
Does our folks in the ATCs have any comment as they sit there huddled together?
ourselves on this issue.
You don't mind taking the mic? I'm just saying in that case, it's going to be sold at other retail stores, and it might not make sense.
I'm sorry, Mr. Chairman, I'm still not clear on the question you're asking here.
So if rather than your stores remain keeping their own identity on a storefront basis, you still have the products your therapeutic products, correct? Now, those have their own brand identity as well.
Correct.
Those products, if each of your respected establishments became a retail store, it would have to have the New Hampshire franchisee logo, and that's it. And what I'm suggesting is, if you still want to sell your therapeutic grade products, which my understanding is you do, it does somewhat result in an unfair market advantage if only certain retail stores are able to sell the therapeutic grade products. I would think it would be to the ATC's benefit if all the retail stores had an opportunity to sell the products that you ATCs could exclusively manufacture. But at the same time, if we went that direction, I think it would make sense for a lot of the oversight and enforcement and regulation to fall under the Liquor Commission, not DHHS. With that being said, if we went that direction, which is the direction I would like to go, I'm not sure if my friend to my left agrees. I'm not sure how everyone else feels about that. How does the ATCs feel about that?
Well, as we said last week, we do have a strong preference to be able to operate dual use locations. We understand that's a policy choice for the commission and ultimately for the general court. There are a number of policy questions kind of rolled into one here. We would like to be able to expand access to patients so they don't have to drive to one of 7 locations. It would be beneficial for patients if they could purchase therapeutic cannabis at any store. The only question is how to provide the education and support services that particularly first-time patients and making their initial purchases would need. There are some gaps that we think would need to be filled, and we think those gaps can be filled. But in terms of whether it's an unfair advantage or disadvantage, I mean, we're not talking about a huge market here. We're talking about 13,000 registered patients, a number that's likely to decline after adult use. So in part, there is an advantage being able to serve both markets, but it's also a bit of a disadvantage, or at least a burden that we would be required to continue serving patients and making, for example, small batches of products that aren't really financially lucrative. So it's kind of a mix of advantages and disadvantages, I would suggest.
No one's requiring the ATCs to sell to other stores. That's a business decision left to be made by each of you respectfully. And one of you may choose to do it, some of you may not. But I think the issue is when it comes to defining consumer, I thought if you did that, you're going to have other revenue sources from cultivation, but I would like to see if that's for the consumer definition wise, we may not want to have a distinction between the two for the purposes of this chapter.
So if I may provide a hopefully relatively simple answer, is that generally the regulations between adult use and medical are very similar in most states, and I would expect them to be extremely similar here, if not able to be made identical. So I would hope that there'd be limited barriers to the opportunity of doing that. So I think it's very doable.
Again, so my concern is a dual use single store is problematic for both regulatory reasons and as well as taxation reasons about what products are not taxed and which drawer do you put the money in. I mean, all kinds of basic functional problems that I think it's hard for liquor to be able to deal with the dual use single store. I was clear. I support a dual, again, ATCs are ATCs, retail stores are retail stores. Separate models, separate regulatory models, separate regulatory agencies that deal with that. That does not prohibit an ATC who may have a strain of product they want to offer in the retail store to be able to do that. However, the labeling and testing would be subject to the rules and conditions that the liquor store would put on it. So you can move product A, you grow a whole bunch of product A and you'll use a section of it for for your medical distribution, but then you also go to liquor and say, I want to approve, have this product approved for the sale in the retail store. You can sell that in your own retail store, or you can offer it for all retail stores. Again, that's up to you based on your private model that you would have. So you may have product A in retail store 1, but you don't own retail store 2, so therefore you're not making it available to retail store 2, and that's your competitive advantage. Is the product that's available in the medical could also be available in your retail store for you to manage. So I think that's the competitive advantage, but I do not want to enter into a situation. I don't want to enter into a situation about who's the controlling authority in a given square footage of a building based on dual use in a single space.
So I think we're basically, it's not gonna, if you're gonna do retail, I don't think selling therapeutic, it's either gonna be sold in all the retail stores or none of them.
It's up to them to say.
Well, I think that they rather sell in all of them than none of them. I assume. I don't
So again,
think
they can
it's gonna
apply to a lottery for their flower A product to be available in all retail stores, or they can say, I only want to do it in my private store.
As I'm sure the rest of the commission is enjoying this healthy discussion Senator Lang and I are having, does anyone else have any comment on, or wants to join the healthy discussion? Representative Cahill.
I'm always up for a healthy discussion. I'm kind of wondering what the commission, the proposed commission thinks. Are they game for maybe taking over control over the THCs and completely removing it from DHHS?
Well, I don't think they're gonna preference. Are they capable of doing it? I guess is the question.
We're certainly capable of doing it. As far as having a preference, I don't think we have a preference on it.
I would say the other part of that is that even ATC products would essentially be part of the franchise fee, but I'm not sure if the business side of that makes sense if you distribute to the other stores, depends on how many stores there are and your cultivation. But I think making it easier to account for everything rather than having separate draw, is that?
Yeah, just one comment. Brandon Pollock with Temescal Wellness, one of the ATCs. Insofar as an operational perspective, it's not our policy choice, but from an operational perspective, if accessories, for example, or paraphernalia will not be subject to a franchise fee, I think a therapeutic product would have no additional issues of that sort of bifurcation of the fee structure.
I mean, I definitely think our goal as a committee should be able to keep the cost for the therapeutic users as low as we possibly can.
I understand that. My concern is when it comes to a franchise agreement, if you don't have the 15% at the beginning, I'm not really clear what you're gonna be able to add it down the line in a responsible way. So it's kind of now or never. And from what it sounds like, the therapeutic industry is might get smaller and smaller and smaller. I'm not saying go away completely, but it might become a very minor sector of the market. And at that point, you're gonna have all these therapeutic products. What happens in Massachusetts, there's like a 20% sales tax, which is very high. You can spend $300 I don't know if that's the exact price for a license, a medical card, or whatever they call it, and you're exempt from that tax all the way, like for the rest of the year. You also get to cut the line and have your own register. It gets around the revenue side of things. So one thing that could happen is that the therapeutic side can kind of readjust its policies and get a larger market share. It's going to cut into the franchise fee, and rather than have those competing interests, it seems we're going to essentially grandfather in on manufacturing the higher therapeutic grade stuff, but it's not going to overtake or really diminish the franchise model. It seems like everyone's kind of getting in a good position there. But if you don't do the 15% now, or whatever the franchise fee is determined to be, adding it in 3 years from now, 5 years from now, I don't know if that's legal, appropriate, fair business model. So if you're going to do it, you want to do it now, not later. It's my opinion. Let everyone know what they're getting into. We don't have to answer this today. It's, again,
This is good discussion.
imagine if we didn't do it now, then 3 years from now, we decided to add 15%, you're gonna be looking at us like how could we? So I think it's important to know what the commitment is and let us know business-wise, perhaps maybe the next meeting, comment on that.
Sure. I would just suggest there are other stakeholders who'd be interested in this policy choice, and certainly patients would object to a tax or fee being imposed that would apply to them that does
Well,
not currently.
The fee is paid by the franchisee. You know, how you adjust your prices to the consumer, you can really take care of the patients. You know, you're gonna have to judge that any way you can. And that's why I'm asking, does the business sense make sense? Remember, you guys are gonna make money off cultivation sales to all the retail stores that are out there. There's other revenue that can be made as well. So I think it's, hopefully that should keep the price down too. But, so
We'll move
come
on
back-
from consumer.
We'll come back to
We'll
the
come back to
consumer
it.
definition.
Department means the Department of Health and Human Services, number 14. Any discussion there? We're good?
Well, do we want to completely remove the DHHS completely from any control over?
Well, I think later on in the bill, we have some conversations where DHHS might have some stuff around labs or some other testing and some other components. So I think that's the only reason it's in there is, again, we need a definition. If we talk about the commission, we talk about the lottery commission, we say department, we talk about the Department of Health and Human Services. Number 14, we addressed. Are there any other, so we agreed to strike the last sentence. Is there any other changes to number 14 or 16 rather?
Mr. Chairman,
Chief?
on 16, in light of some of the testimony we heard earlier today, we'd like to recommend that this refer only to in-person sales, that it not be online sales or delivery or anything of that nature.
Does anyone have any comment on that?
You can make an online sale of Dunkin' Donuts, but you gotta show up to pick it up. So that needs to be addressed, Chief. So when you say no online sales, you're talking about online and delivered by a third-party sales.
Yeah,
Okay,
I
but
think
you
I-
could
I
still,
understand what
you
you're
could still,
order it,
order it online,
but you have to pick it up,
but you have to be picked up.
or, yeah,
I agree with that.
I could live with that.
So what are we looking for a change? Where do you want to put a change again, Chief?
At the bottom or the end of 16.
Okay, what do you want to
I
add?
would just say in-person sales only, or we could be more specific with the online. But the whole idea is just to make sure that people aren't, again, in lieu of, in reference to the earlier testimony about the difficulties that, for example, Maine was having with online or not in person and being able to identify themselves as an individual capable of buying. I mean, people do that with alcohol all the time now. They're buying it and minors are buying it online and what have you, so.
So the question, one thing I want to be careful of is if the program extends to the point where I could go online and order it, but I have to go in person to pick it up.
Pick it up.
Right?
Yep.
So it allows for online ordering, but in-person distribution.
Sure.
I agree with that. I think we certainly not there yet. If that policy is revisited by future legislators, but I think out of the gate, you got to come in person. That's just that's what I'm talking about.
We just want to make it clear that's the situation. So it's not.
Yeah, I mean, we
One of the things I was in New Orleans, and they literally have dispensary Ubers that deliver your drugs for you, right?
They most certainly do.
And so I want to make sure New Hampshire doesn't become that.
I agree. We don't want like Weed Dash.
All right.
All right, so number 17, and I guess I have a question on 17 and 19 is why we're defining what an immature and a mature plan is if we're not dealing with cultivation anywhere else in there for home grow. I'm not sure we utilize this language anywhere else, and I'd recommend striking number 17 and 19.
Any comment on that? As we just go through this, please look for any other unintended consequences by striking those. If you
Well,
see any other references to mature or immature plans, but yeah, I agree, strike it because it's on.
Number 18, inflation.
Did we go to the possession limits?
Well, we're above it. We're in between with
sorry.
this one.
Need glasses?
I'm walking through, so I'm not sure where this is used in the chapter, and I don't know why we have a definition of inflation, but I guess I'm gonna withhold comment until I see where else it's used in the bill. I didn't see it anywhere, but if it's not, maybe we can strike it, but
Yeah, and if we didn't define inflation in this chapter, it's already defined by, when you say inflation, it has legal definition, so it can be, I think we'll take it out for now in the interest of trying to keep this under 100 pages. And if we need to put it back in, we understand where to find it.
Number 20, municipality means a city, town, or an unincorporated place. Again, I think this is relative to, we use municipalities for two purposes further on in the statute. We talk about who can authorize, the zoning and regulatory stuff, as well as we allow for some of the fees collected by the state to be returned to a municipality. Number 21, any other comment? We're good there? Any, 21. How late we going, Daryl? How long do you want to go?
I mean, I could be here till 7 o'clock, but I don't see no one else.
I'm not sure we're gonna go that far, but,
How's everyone doing so far? Everyone's brain's working good?
all right. So number 21, possession limit. Chief left on the most important part.
Well, I did speak privately, and I'm not going to hold this any over. We have another chief here. Would that person perhaps like to take the place of the? Are we allowed to do that?
Sure, yeah. It's a
Anyone have any
participating member.
problem with the chief replacement? Introduce yourself. He's probably ready to go. You probably ate lunch already. Unlike the rest of us.
Certainly. My name is Pat Sullivan. I'm the Executive Director for the Chiefs Association. I'm also a retired chief from Goffstown.
And thank you for joining us. Possession limits, my understanding is there's some disagreement on that. I know for cannabis products, it says what's written here is 2,000 milligrams of THC. A friend from Maine is laughing at us. So this is the possession limits that are not per serving. It's how much you have in your refrigerator, whatever you keep it.
5.5 milligrams in, not flour, but manufactured products. I think that's what it is in May.
But how many 5.5 milligram squares or candy bars can one person legally own in their possession at once?
It's not five, it's only 100 milligrams. 100 milligrams per package, and that usually for 10 pieces of 10 in it. Okay?
Yeah.
But
How many of those candy bars then can you have is the question. If it's 100 milligrams in there.
5.5 milligrams.
If I want to walk into the store and buy every single candy bar and gummy off the shelf, I would probably even exceed the 2,000 milligrams. I'm saying is how much am I legally allowed to possess without violating the law? Is it unlimited? Is it?
No, it's not unlimited. I don't have the list in front of me, and I don't work at the stores, but it's a reasonable amount for flour, for example. I think it's 2 ounces.
Yeah.
2.5.
This says 4 ounces for flour, 20 grams of concentrated cannabis products, and then
Mr. Chair, does this possession definition apply to people that are transporting it for manufacturers?
it wouldn't, because that would be this is your consumer.
Right, this goes back to the consumer definition.
So
and
this is the person who walks in the store. If they exceed a certain amount, are they now eventually in violation of the law? And I guess the question is,
So let's start with A, right? Is everybody okay with A? Is there any definition of A that's different? Chief?
We're looking with for 2 ounces of marijuana in the cannabis, cannabis in the plant form. So it's list 4, but we would go, we think 2 would be acceptable and reasonable.
I think erring on the side of less is a good idea. And the gentleman from Maine, our friend from Maine, just said that 2 is what Maine, he believed what Maine does.
So
Maine is
could I
2.5, right?
ask a different question? What do we just set for a limit on decriminalization? Possession of how much?
0.75, I believe.
0.75 ounces.
0.75,
Three-quarters
of an ounce.
Yeah, I mean, just a couple things to flag here. I mean, I think we would definitely prefer to keep it at 4. And I think if you look at this in the context of alcohol, for example, I can go in and buy as much whiskey as I want to buy. And I think it's important. The other important thing to remember is we have sales laws on the books. And so if someone has 4 ounces and they're caught selling outside of the authorization in this legislation, they can be prosecuted for that because they're going outside the bounds. But this is just personal possession. I think that's totally fine to have 4 ounces. And if they're doing something illegal with that 4 ounces, then there are multiple ways under current law for that person to be held accountable. But I think it's odd to kind of have that limit here, but then with alcohol, which is, I think, objectively more dangerous, we have no limits at all. You can buy, cases and cases and cases of whiskey without concern.
So I just wanted to add, I was just looking up what Massachusetts is doing, to add to Maine and saying 1 ounce of flour, 5 grams of concentrate compared to 20 we have here, and 500 milligrams of edibles versus 2,000 milligrams.
What was the last one?
500.
Yeah, so it was 1 ounce of flour, 5 grams of concentrate, and 500 milligrams of edibles.
So I would go with the 2 ounce myself. If that's what some of our surroundings are. Again, remember we're dealing with people who may come from Massachusetts to New Hampshire and have more than the 3/4 of an ounce possession limit we have now. So I think erring on the side of caution. I think we adjust to 2. It keeps it consistent with Maine, semi-consistent with Massachusetts. And so we don't have these tourists that are coming in that are becoming accidental criminals because of their possession limit in their state slightly more than the possession limit in our state.
If I could ask our good friends from Maine one question. You can point at someone else, but realistically, when a consumer comes in the store, how often do they buy what a consumer, and it's just speculating, how often do they actually buy the possession limit?
I'm sorry, if someone's going to speak to the commission, they should speak into the microphone just for the public, yeah?
What was the question again?
In your experience, and I understand that you're
Yeah.
speculating or making an estimate, how often do consumers come into the store in Maine, which has 2.5 ounce flour limit?
Yeah.
How often are consumers actually purchasing that 2.5 ounce limit?
Well, first of all, we don't sell it in ounces, right? 80% of what we sell in 1/8 ounce jars. So, an 1/8 ounce jar is about $40 retail. Okay. So how much we do it on how much they normally spend. We have 2 ATMs in there and we trace everything. And it averages about $80 a customer. Is there people that go in there and spend $500 or $700? Yeah, there absolutely is, but generally speaking, the average customer is spending $80.
So out of 50 customers, how much would you say are going to buy?
Well, give me a level. To spend more than $200 and a visit?
No, this has to do with the amount not how much money you're spending. It's the amount you can legally possess. All right. If it's 4 ounces, it's higher than Maine. But if we made it 2.5, like Maine, I'm just asking, as we debate whether it should be 2 ounces, 3, 4, whatever, I'm just asking how often is someone coming in, even buying that large of a amount of flour?
On a regular basis, it happens a lot, especially because we're in an area where there's a lot of vacationers, and they're not necessarily in legal states, so they come and they'll buy stuff to bring home with them. So it's a regular. For somebody to spend $200-300, I'd say 2 or 3 an hour do that. Someone to spend $500. One every few days. Someone to spend $1,000. I don't think I've ever seen that. I've never seen that.
Mr. Chair, again, I'm just looking for consistency across the board. In our medical cannabis program, it's 2 ounces. So it creates a consistent law across the board, whether you're in a medical or in regulatory, you have a 2-ounce limit of possession.
But their stuff is stronger, higher potency than what the consumer product.
We have no idea what the consumer product looks like yet. We haven't got there.
Well,
Mr.
Again, in our law, from what I'm looking at, it says a patient can possess no more than 2 ounces of, it says unusable, which I don't understand why, but cannabis. But, again, it's 2 ounces for the purposes of plant material in our statute. And that's usually how law enforcement views it, is in ounces and pounds and kilos.
What is the price of 2 ounces of product?
We don't sell too much.
Okay, could we do a conversion?
But in 8-ounce jars, well, it's 40 for an eighth, so that's $3.20 for an ounce. But again, it's not the same as buying an ounce to buying a volume. You're buying different jars, different products.
So $3.20 an ounce. So you're looking at $6.40. You just said maybe one person a week would spend $6.40. So
$640 an ounce?
no, $3.20.
Oh.
Massachusetts more.
Yeah, the black market would take over the industry if it's sold at that price.
Remember, none of that's tested. It's got lots of mold in it and pathogens and bacteria.
I would like to err on less.
All right.
So Mr. Chair, on 11, Dave?
I think we just heard from medical experts, and they talk about how youth are getting the product and they're getting it from people buying marijuana for them. I think we should be the lower the better, where somebody can't go place an order and go buy it for youth. I think it makes more sense from a public health standpoint.
Mass is 1, Maine is 2.
I think Maine's 2.5.
2.5. And our medical is 2. So my recommendation would be we change A to 2 ounces, B to 5 grams, and C to 500 milligrams, the last two at the doctor's recommendation. And I think that keeps consistency across our
So
laws.
can I,
I just give a Senator Lang.
all right, listen, I understand that. I just want one thing to be considered here. And I've asked this question and I never can get an answer, but I'm asking again. In the prior recreation bills I would see, it had I think it said 1 ounce, I forget what it said for grams, whatever. These stores are only selling limited products. And in New Hampshire, we make a lot of our sales in retail comes from out-of-state consumers buying in bulk. I think our liquor sales is a large percentage go to out-of-state. Now, I don't think, maybe 4 ounces is too much, but part of a lot of the consumer models in retail, not even reference to just cannabis, relies on people coming here, whether it's for vacation or coming over the board in the weekend and buying in bulk. So, and these numbers here, which when I put together 1598, was kind of throwing them around loosely, explaining that part of the revenue model is that we sell a lot to out-of-state consumers. Now, if you only can buy a certain amount, I was concerned that a private retailer, is that even enough for them to stay in business if they only can sell 1 ounce or 2 ounces? No one seems to know the answer to that. So if the business is going to rely on, the franchisee model relies on the out-of-state consumers buying in bulk, I mean, we have to make it even. Now, that doesn't mean we open the floodgates and make it 4 ounces, but by making it 2, 5, and 500, are we limiting our, I guess, hurting the franchise model? That's a very loaded question that I just asked. So, now I'm not saying it's responsible to make it what it is today, what it says here for, that's a large amount, but if the system's not going to be viable, the franchise model, because we lose the bulk sales, what happens? I think having the failed system is worse than the high amount. Which is why these numbers, when I put these large numbers together, as you can tell, I'm not really a fan of the numbers, but the idea was to make the system viable and max your out-of-state sales. And I think liquor out-of-state sales is between 40 and 50%, am I correct? So I understand that this is a tough pill to swallow for some of us. You understand the point that I'm making? I'm not saying
Yep.
it's
So I think there's a lot to consider here. We're also almost at 1:30. We've been here since 10. No one's eaten lunch, so maybe we need to settle on that question. Just percolate a little bit more.
And everyone's giving me a stare like I'm crazy.
I mean,
But-
well, right.
no.
I think people are tired. I am. I'm hungry. There's only so much we can ask commissioners
We'll
to
just
do in one
finish.
day.
We'll just finish it. Everyone's okay.
I agree with my colleague. A good friend uses the halt. Hungry, tired. Yeah.
So you're suggesting instead of it's hungry, tired, and angry?
Or just whole, I mean, I think this is an important
Yeah,
question. We want to,
yeah.
I would like to
All right,
percolate
so-
on it a little
So
bit more
maybe
before
we,
deciding.
maybe we kind of rest on that. When's our next hearing scheduled? Big- So November 3rd? Is everyone good on Friday the 3rd? I have a conflict in the morning, but you guys, I'm sure would love to carry on without me.
Third?
Yeah.
Oh, I don't have that, I don't have that on my calendar, but I think the senator was mentioning that there's a conflict with fiscal. Oh.
I'll print my assignment before the time.
On the 3rd?
So we're doing a third at 10 o'clock again?
We can.
Okay. So we're gonna stop on possession limit. Everyone go home, think about it, come back. Chief, Commissioner Moliker, if you could just take a look at to the chair's point of how does bulk sales impact your idea of a model and what that looks like, so we can have that part of the discussion, whether increasing possession limits for the purposes of sale, what that looks like, and come back with that on a revenue model, what that might be. And then Dave, remember you're bringing that section 3 of the funding formula to talk about the alcohol and other drug fund for treatment, and the doctor, you have your homework assignment. And with that, we're done.
We are adjourned. I'm the weird one, I get it, but I.
We're gonna give out cultivation and manufacturing retail licenses on this day. You need to give out cultivation licenses.